What are you up to?
Sitting here meditating and pondering on the ways of the world today. Thinking of my people Africa and the state of the continent today. How mothers fed their children today. As granny goes down on her knees every day and prays. How many souls are dying from causes that could be prevented? If we did have leaders who cared for us today. Oh, 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 Zion and Yahweh. Zion away. Zion away. Africa rise, young. Every 4 years, the politicians say he's your servant today. After you vote for them, they metamorphose into your masters. I say, have your say, we'll have our way, yeah. Not no strange, it's cow demon crosses. Meanwhile, souls are dying from causes that could be prevented. If we did have leaders who cared for us today. Oh, oh, oh. Zion and Yahweh. Zion away. Zion away. Africa rise.
We can be great. World turbulence among the politics. Never hypocrite, lava. Never ever quit, just a little bit longer. Victory is near, they're gonna disappear, go under. Leaders them no care, never tend to share. Babylon quit, the shedding of blood. Your heart a go suffer if you show no love. Stay away, consciousness. What we call the nation if for no righteousness. Just make sure the children live.
I pray for the future generation not to give up this fight. I pray for the children of tomorrow not to sell out their birthright. Cause when I look out far, I see the strangers eating up your food. Another form of slavery is coming here again. And that's why people are dying. Causes that could be prevented. Oh yes, we do need some better leadership today. Oh, oh, oh. Zion and Yahweh. Zion away. Let's go. Zion away. Africa rise, young. Don't be moved. But as the day breaks, I see my people rising up again. Shaking up all the shackles. I see my people shaking up those chains. The lion with the mane. Blood of the slain will never, never, never be in vain.
Never, 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 never.
No, no, no. We don't want to see no more people dying from causes
No,
that
I want
can
it
be prevented.
No more
Bring that better leadership today.
I pray.
Oh, oh, oh. Zion and Yahweh. Zion. Yes, indeed. I'm a 1212 Radio Culture live on iCulture TV this moment. You are welcome to the weekend live stream. My name is Kwesi Eson Bako. I have the singular pleasure and opportunity today to be in the seat bringing you this extraordinary show today. Today's a mixed bag of politics and some personal health stuff. As advertised, we are bringing you in our first interview. We might actually switch the interviews around. Second interview may become the first interview, very sure of that. But I'll confirm that for you in a second or so. Because in the first interview, we will be speaking with Victor Wutor. Victor Wutor is the founder of Asthma Ghana. Asthma Ghana. You know, asthma is one affliction. I don't know what to call it, a disease. What is it? We'll learn from the expert. But asthma is one thing which I think goes overlooked or unchecked a lot in Ghana. And we will be speaking about Victor Wutor, who's a registered, certified pharmacist, and a whole litany of other things we will be telling you about in the course of the show. But yes, we'll be talking about asthma with Victor Wutor, some of the critical interventions that his outfit, Asthma Ghana, are putting in to check asthma, which to a very large extent goes undiagnosed and unchecked in a part of the world. Victor Wutor will be our guest. And in the second interview, we'll be speaking with Hobson Adoye. Anybody who's following Ghanaian politics, we need not introduce Hobson Adoye to you. Everybody knows who Hobson Adoye is. For our international listeners, however, and viewers, however, Hobson Adoye is the Director of Operations for the newly formed United Party. Hobson will be joining us to speak about the United Party. General questions, general issues about the United Party. This is one interview I would say you do not want to miss. Today's show is brought to you by Roots Organics Farms, and also Chrismark Products. We're going for a short commercial break. When we come back, show star.
Since 1994, crafting natural products with organic shea butter and red palm oil. All products are available on Walmart.com and Shopify, or visit our website at chrismark.com.
Welcome to Tucson Hotel, your ultimate home away from home. Located in the serene town of Ejisu Ichakrum, just off the Jabin Road. We offer you a haven of comfort and luxury. Step into our fully air-conditioned 40 bedrooms where modern elegance meets convenience. Whether you choose our normal, standard, deluxe, deluxe standard or executive rooms, each one is equipped with Wi-Fi and DSTV, ensuring that you stay connected and entertained throughout your stay. Indulge your taste buds at our exquisite bar and restaurant, where our skilled chefs prepare a wide range of culinary delight to satisfy every palate. From local delicacies to international favorites, we have something for everyone. Planning a business meeting or a special event? Look no further than our state-of-the-art conference hall. With a capacity to accommodate 80 to 100 people. It is the perfect venue for your corporate gatherings or social celebrations. But that's not all. We proudly boast the largest recreational center in the Ejisu municipality. With a capacity to accommodate up to 2,000 people, it is the ideal location for concerts, weddings, and other grand events. It comes with 4 fully air-conditioned bedrooms and a kitchen as one package. Our luxury cars are also available for rent. Drive like a boss. To experience true hospitality and unmatched comfort, contact us today. Our friendly staff is ready to assist you. You can reach us at 0244 654 458, 0246 505 327 or 0241 418645. You can also email us at info@tucsonhotel@gmail.com. Tucson Hotel, your home away from home.
Okay, show starts. As I said, first interview, we are going to go straight to speak with our guest. Us already advertised. We will be speaking with Victor Wutor. And full disclosure, Victor is a personal friend of mine. And I know our international audience are probably saying Victor. We say Victor. I'm sure if I called him Victor, he would correct me because we used to call him Victor. Victor Wutor. Victor is a personal friend of my class, mate of mine from best school in Ghana, St. Peter's Secondary School. Are you me? All right, let's bring on Victor. Hold on a second. Newsroom, the background, please. Background. Radio, culture. All right, let's bring on Victor Wutor. And before he says his first words, please permit me to tell you who he is, because if I ask him to, he'll probably not say all these things. But I am going to tell you who my beloved friend is. All right. Now, Victor is a PhD. He holds a PhD in biotechnology. He's a doctor of public health, has an MBA in entrepreneurial management, an MSc in applied microbiology, Bachelor of Pharmacy, certified respiratory educator, a practicing pharmacist, clinical professor at the University of Alberta, Canada, a fellow of the Ghana College of Pharmacists, senior consultant at AE Consults, Lethbridge, and for today's discussion, most importantly, the founder and board chair of Asthma Ghana. How? Radio culture. We will have that discussion on a personality interview. But today we're here to speak about asthma. My friend, my brother, how are you today? Welcome to the show.
Thank you very much. I hope you can hear me loud and clear.
I can hear you loud and clear, and I can also see you. Thank you very much for making time.
Excellent. Thank you so very much for having me on the show. And I want to use the opportunity to say hello to your listeners. And then, here to share ideas, learn from each other. And then, we so we get better. We can be of use to humanity. Thank you very much.
Very much. Thank you, Sly. And let me start by asking you a statement that I made, which to me is hypothetical because it's not research. You are the expert. Help us understand this, if what I said is accurate. I think that in Ghana, asthma is very much on a general level undiagnosed and unchecked. Some people don't even know they have it, but they suffer from the symptoms. Is this accurate?
Yeah, I agree with you to a very large extent. And I mean, with Asthma Ghana, we have a patient support group of almost 400 people. And then some of the questions you get from people, you get to understand that, look, asthma is underdiagnosed and undertreated in Ghana. So what you said is absolutely true. Yeah.
Okay. What is asthma to start with? Some people know it's some type of respiratory condition, but there are different types of respiratory conditions, aren't there? What exactly is asthma?
So asthma is technically it's a chronic medical condition that affects your airwaves, and then it causes inflammation of your the airwaves, and the muscles become very tight. And some of the typical symptoms that we normally have the 4 cardinal symptoms of asthma. So to begin with, there's inflammation there, there's narrowing your airwaves, and the typical symptoms, which are, like I said, the cardinal symptoms. You have coughing, which normally is worse at night and early mornings, and you have wheezing, and you have chest. Your chest, you feel like your chest is so tight, kind of thing, and you have difficulty in breathing. That's gasping for breath. Those are the 4 typical symptoms that we see, and asthma affects virtually everybody from day 1 of birth till probably the last day. You can find asthma along the spectrum.
Why? So, okay, why? This is a follow up to something you said earlier. Why is asthma worse at night, or at least that symptom of coughing? Why is it worse at night and in the mornings? What accounts for that?
So you see, so when there's inflammation in there, all right, the airwaves get narrow. Okay, and when you are active, the body is working, so a few things are happening throughout. But when you lie down, like in the comfort, nothing is happening there. Now we come to see that the cough, because it's the issue of the muscles. There's a problem with how the muscles are aligned when you're lying down and when you are awake. That is what kind of prompts that situation. And also there is a school of thought that we have what we call the circadian effect. These levels of some chemicals increase and decrease in the course of the day, and when you sleep. Some believe that is what comes into play, but generally we see that commonly with especially children. The coughing is worse at night and also in the early mornings.
And then some of the symptoms that you described, those cardinal symptoms that you described, those are not peculiar to asthma, though. Other conditions share these symptoms. Is that not the case? And if that's the case,
that is true.
How do you tell the difference between whatever other condition that may be and asthma?
Well, that is true. There are several other conditions that will maybe the same kind of symptoms, all right? And then, so let's say that we know that if your mother has asthma, there's a high possibility of you having an asthma, all right? And we know that if you have asthma and you are given a medication, some kind of medication, we're expected to reverse the symptoms immediately. All right. But the best way to establish that someone has asthma is to have a test. With a spirometry test, which would tell you exactly that you have asthma or you don't have asthma. Or it may not be a borderline kind of thing, but your best bet in order to know whether you have asthma or not is to have the spirometry test, which could be done, and then yes, it is there. Another example is that if you have COPD, which is more is common, especially who smoke, and it gets worse and worse and worse. There isn't much you can do about it. But with asthma, if you take the treatment, if you have an asthma attack, we give you treatment, and we expected that you should reverse the symptoms or you should get some improvement. But with COPD, over the years, it gets worse and worse and worse till your creator calls you.
Interesting. Which means in COPD, there's no reversal at all whatsoever. No known treatment can reverse COPD.
No, we
Whereas
make your life comfortable.
asthma is actually reversible, or at least maintainable,
Yes.
so to speak.
Yeah. I mean, even though asthma is a chronic medication that we know, a chronic medical condition, and then it could have a massive effects on your life. I mean, asthma under proper treatment, all right, it could be maintained to the point where you can live a normal life without any effects. If your asthma is under treatment, more often than not, we can treat it, right conditions and everything. You should be able to lead a normal life. As a kid, you should do what every child does, and an adult should do everything that's an adult does. Unlike in COPD, we just make your life comfortable, try to make you breathe well, try to make you live longer, kind of thing. But down the line, it's just going down. It doesn't get better.
Wow. No, before we continue, let's look at some. Okay, we've looked at the definition. Obviously, everything is in the these things that you said to us. Let's look at some statistics. How bad is asthma in Ghana? Is it something that we should spend nights, sleepless nights over?
Yes, I do believe that. I mean, statistically, there is a publication out there which tells that we have, on the average, about 12% of the population has asthma. Another publication tells me it goes to about 20-something%. So it varies. And the truth about it too is that, I mean, if you conduct a research in, let's say, Accra or Kumasi, chances are that you're going to have a higher percentage. And if you do that in my village, in the Volta region, or in the village somewhere, chances are going to be lower, because there's a variation in the asthma prevalence based on where the research is conducted. It's higher in the urban areas compared with the rural communities, and then also time of the year and a lot of things. So for me, I asthma 12, even if it's the 12%, which is the average, is still of concern to me. I mean, then it's something we cannot let go, because look, every life is precious for me. Every life is precious, and asthma death is something that should be preventable. So if we can prevent those 12 out of every 100 people who die, that is massive for the country. So for me, we need to do everything as possible to save lives.
Is it practical though?
Yes. I mean, look, I have. Let me tell you, the biggest challenge with asthma is the underdiagnosis, and even the treatment is a big challenge in our part of the world. And then we'll talk about one of the projects that we are doing with Asthma Ghana, where I'll draw your attention to something. The drugs are expensive, so people tend to use drugs which have massive and extreme side effects, because at the end of the day, they get some relief once they take the medication. But there are proper medication that we know that if you use them consistently, you're going to have relief, and you can go without asthma attack for a period of time. We know that's a fact. But if the drug is expensive, the person cannot afford to buy them, the health insurance is not supplying them, and definitely it's of concern.
All right, let's watch this video really quickly, courtesy Joy News, and I want you to react to some of the things in there. Let's watch.
Affecting millions globally silently. More than 250 million people live with the condition. Sadly, about 450,000 die annually. That's according to the World Health Organization. In Ghana, asthma accounts for up to 10% of all hospital admissions among children. That's more in the following report.
According to the World Health Organization, an estimated 250 million people across the globe are living with asthma, and around 455,000 people die from the condition every year. In Ghana, asthma is responsible for up to 10% of all hospital admissions among children, with thousands more affected by the disease, often exacerbated by poor air quality and limited access to inhalers. Dr. Juliana Oye Ame, Chief Executive Officer of the Trust Hospital, speaking at the commemoration of the World Asthma Day here in Accra, has called for urgent investment and policy reforms to address the critical shortage of asthma care in the country.
Asthma is not only a personal health concern, it is also a public health challenge, as research informs us that over 96% of asthma-related deaths occur in low and middle income countries where access to essential life-saving inhalers is often limited or completely unavailable.
Currently, 1 in 3 asthma patients in Ghana is able to receive appropriate inhaled treatment, despite inhalers being the gold standard in asthma management. Dr. Oye Ame further emphasized that the lack of access to proper inhaled treatment is a national crisis, leaving many vulnerable, especially among children, as asthma remains a leading cause of hospital admissions and mortality.
According to data from the World Health Organization, asthma was responsible for 1,979 deaths in 2020, accounting for 1.13% of total mortality, with a death rate of 13.95 per 100,000 individuals. And these statistics extend beyond mere numbers. They signify the loss of mothers, fathers, children, and potentially our colleagues.
The global.
Okay, so Doc, let's look at these statistics so far. Does anything connect, or does anything?
Yeah,
Is there somewhere?
the information is accurate there. I mean, the total. I don't know when those thing was. But she mentioned about 250 million globally. As we sit now, it's about 268 million now. All right.
Obviously, this is a little.
The numbers are very true, and no, we can't sit aloof. It's not acceptable any longer. And like I said, the biggest challenge we have is the diagnosis and the treatment. We talk about it. Ghana now, everybody's talking about effect of hard drugs, effect of galamsey and everything. But if you look at asthma is just one of the. I look at it as one of the low-hanging fruits that we should be able to tackle easily. We shouldn't let any. Go ahead.
So one of the things that was mentioned in that report, which I think also, to borrow your words, very low-hanging fruit, is the issue of air quality, right? In Ghana, we don't have too much government control over the quality of air we breathe. People burn tires, people burn rubbish in their backyards, people anyhow, as we say,
Yeah.
What's the connection between air quality and asthma? And what do you think the government should do to, clear this low-hanging fruit so we can worry about the higher fruit further down the road?
Yeah, I tell you what, asthma, as we say, is that normally what we say is that we have trigger factors, things that precipitate asthma. All right. With some people is some kind of food. With some people is the dust. Some people with allergens. Some people with what they inhale, smoke, and all those things. So anything can be. Some people is just perfume. All right. Now we have different trigger factors for asthma. Now, when it comes to air quality, like I said, there is a huge discrepancy between prevalence of asthma in the urban areas compared with the rural areas. In the rural areas, the asthma prevalence is very low because the air quality is good. It's in the big cities like Accra, Kumasi, and that is where we have all those, so many vehicles with the carbon monoxide in the environment, the burning of tires, and using it, when you go to the butcheries and all those kind of things, all those things are affected. Look, we have laws against all those things, all right? But the fact of the matter, you and I know that Ghana, the laws are there, but we do not respect the laws. Now, the government has got to start doing something about some of those things. But for the meantime, whilst we're trying to make sure the laws are respected and applied properly, I think that we should make the drugs readily available. They should be affordable so people can use them instead of relying on herbal products and other things which do not work. All right. Look.
Tell me something about that.
So technically speaking,
radio culture. You saying herbal products don't work for asthma?
Let me be very straightforward here. I am a fan of herbal products, and I believe that it is an area that we have to research in thoroughly. Okay. Now, this is my challenge here. as we sit here today, there is no treatment for asthma. Now, I've received emails from several people who claim that they have medications that cure asthma in 1 month. It's a herbal product that you take it cures your asthma. Now, when you ask them, has it been tested? The answer is no, but we know that somebody used it and it worked. That is not scientific enough. All right. But we know, scientists, as we stand now, we know there's no treatment for asthma. But it's an area that we have to invest money to try and figure out if there are products out there that will actually work.
I see.
Now,
okay.
let me tell you something. Let me tell you something straightforward. Yes. Now, when you take a herbal product for asthma, you could have, because look, whatever you are taking, you are inhaling, it contains an active ingredient. It is possible that the medication or the herbal product has some level of some of those active ingredients. So you are going to get some relief. However, in addition to that very good active ingredient, there could be 1,000 other things which could be damaging you, causing problems, which you wouldn't know. That's why I believe that as a country, we should spend money, research our herbal product, because there is a lot of good in there.
I see. I think you've answered the question I was going to ask you just moments ago, which is that if let's agree that herbal products can't cure asthma, but can they at least maintain, control asthma? But I think you've answered that to a certain degree. But if you want to add that for me, please.
No, I think look, I have no doubt on my mind that some of those products can help give you relief from asthma attacks and also help relax the muscles and stuff like that. But we need a lot of research into that to establish the quantities that you need to use for an adult or a child. We need to establish all those things. Don't just tell me that I drink a cup of this and I should have relief. The same cup for my son who
one size fits all. Everybody drinks the same.
That is it.
You are very right on that. I think that's one of the areas that herbal medicine should definitely look into. But let me ask you, and again, you've covered the grounds on the causes, but did we explore everything? Because we did highlight air quality, right? And then you went on to highlight some other factors. Did we cover everything, or are there some other causes for asthma?
Oh no, so look, some of the causes we know, is hereditary in some families. It runs through some families. There isn't so much can do it. It runs through some families, and the environment plays a fact in there. And like we all have trigger factors, and we also know that there's some interesting relationship between people who have some medical conditions. Like if a child has eczema, all right, now. It is something that doctors have to start looking at for. There's a possibility of asthma popping up along the line. And we also know that asthma is very close related to people who have GERD, that's esophageal reflux, things like that. And one thing I also need to mention is that, look, we know that with asthma, between boys and girls, all right, before puberty, asthma is more prevalent in women. It's more prevalent in men, in the boys. So the boys complain more of asthma before we hit puberty. Once we hit puberty, the women take over. So the prevalence becomes more in women. So normally when you see the data, they show it, it's more prevalent in women. Yes, we know that. By early ages, it's more prevalent in men. Latter part of our life on earth is more prevalent in the women. And it's also, we know that it has something to do with their hormones, estrogen along the line. So women who are asthmatic, they tend to have it tends to be precipitated a few days before they have their menses. So those are some of the things we need to look at. There's something I also want to say on personal level. We hear a lot of pregnant women refusing to take medication for the asthma treatment. I think that is something we need to let them know that, look, there are three things that could happen when you are pregnant, asthmatic gets pregnant. 1/3 of them could have the asthma could resolve or get better. 1/3 of them it will remain the same. 1/3 of them it could get worse. You never know where you will be. And it is better to get treatment than not to get treatment, because if you don't get treatment because you are scared of, you don't even know where you're going to fall. The implication on yourself and your unborn baby are very massive. So for me, it's a no-no. If you are asthmatic and you get pregnant, get your treatment. We know it works. There's a lot of them will tell me, no, I know that when I take some of those medication, it could affect my child. There's a publication out there which says that, some of the steroids that they use for asthma reduce the height of the children. Yes, it reduces the height of the children at the early stage, but when they grow, they catch up easily. But the question I have for you is, would you rather want your child to die from an asthmatic attack, or you rather want him to be a little bit shorter. You can be still short and become the president of Ghana. It doesn't matter. Don't laugh.
No, seriously. I mean, and then short is relative also, right? Because maybe you were going to be 6 feet, and now they're going to be 5'8" or something.
Who cares? It doesn't really matter. But I rather want you to be alive than to let you probably something happens to you because I'm thinking about taking a drug that will protect you. No, don't do that.
All right. So Doc, tell us, when an attack happens, you've described some of the symptoms and all that, right? Which are some of the visible things that we see. But inside of the body, what's going on? Because I've heard that asthma actually kills people.
Oh yeah, definitely. It can kill. So if you look at the picture that I hope our viewers can see the picture there, right?
Yes.
No, in a normal situation, that is how your lung is supposed to be. It's open up. You can breathe in and breathe out. You're taking a lot of oxygen in. You breathe out the carbon dioxide. But when you have an attack, that is what is happening. So can you imagine how you'll be struggling to take in enough oxygen? And don't forget that this oxygen gets into your lungs. It gets absorbed into your blood vessels. It goes to nourish your brain. It has a lot to do. So technically speaking, if you have an asthma attack, it's not just the lungs that is suffering, but a lot of organs in your body will be suffering. Your brain could suffer as well. You could have a brain damage in a severe situation. All right. And you'll be gasping for breath, trying to catch your breath and all that kind of thing. So asthma attack is not fun. It shouldn't be. And we have to do everything possible to prevent it from asthma attack from happening.
Wow. And then what are some of the long-term effects? Somebody who lives, let's say somebody who's living, especially in a part of the world, let's use that example. Somebody, those in that section of our population who are living undiagnosed, right? But I remember growing up, there was this guy where we used to make fun of him. So that's what we used to say.
Exactly.
Apparently, it was funny for some people for some reason. Today, on hindsight, it's very bizarre, but we all used to make fun of this guy so because he was always like wheezing, but nobody even said asthma. It was just like so end of story. For somebody like that who lives long term with that condition, what is likely to happen?
So, at a point in time when you go undiagnosed for a while, it will get to a point where you end up in emergency one day. You get to the point where, look, so you've got something's going to happen to you, and somebody will take you to the hospital, and then they'll realize that, look, my friend, your lung is suffering. You can't even breathe. Then it becomes very difficult at that point in time to give you your quality of life back. All right. So can you imagine that your lungs narrow so much that you're only taking a small amount of oxygen? That's all you can do. Always wheezing, always gasping for breath. That is your quality of life. If it goes on for such a long time, then the muscles become used to that. So they adapt to that situation where that is how they behave. Sometimes when you put in any medication, they wouldn't even expand because that is how the muscles are used to. All right. So the earlier we diagnose that and put a patient on treatment, the better. And like I said, if you are on the right medication, the right doses and everything for medication, you should be able to lead a good quality life. You should do what every child does. You should play your sports. You should run. We have some athletes, high-end athletes who are asthmatic. It's doable. We have footballers who are asthmatics, but they are on treatment. That is what we need.
Let me ask you quickly. In Ghana, we call it Intishewa, at least among the Akan-speaking people. Meaning, say, friend Intishewa, I believe. Do you think traditionally we have any, apart from we're talking about herbal medicine, let's leave that to rest. But traditionally, without the intervention of Western, medical knowledge and all of that, do you think traditionally we have any idea what Intishewa really is and how to handle it?
No, I tell you what, I think I forward it. I think they know. That is how they came up with all this herbal preparation, the herbal products that was giving them relief. Look, the truth of the matter is that, look, asthma has been here forever, and our forefathers were treating it in their own they were using some of those herbs to help them. And like I said, some of the herbs open up your airways for you to start breathing well. So for them, you have treatments. All right. So there is the herbal side of it. I mean, there is the spiritual side of it too, where the sangoma will have to pray for you, or the bishop will have to pray for you. And, as a society, right? I mean, everything.
And the whole psychology behind it.
The devil is there one way or the other. I have to take you to some shrine and pray for you, kind of. So yeah, I mean, definitely. Like I said, I believe that some of the products we use have some active ingredients there which will relax your airwaves, and you can breathe better than when you had an attack. But long term, I don't think it's the way forward.
And I think it's just a matter of researching, like you said, right? Because I mean, we may find some incredible, benefits from some of these herbs when we actually look deeper and regulate the doses and all of that properly. Let me ask you again, does it affect boys and girls differently? Again, you've highlighted on some of that, but generally speaking, touch on that for me. Does it affect females and males differently?
Yes, it does. In that, when as adults, right, when any research you do, I did some work recently. Was it last year? I did some research on that. The prevalence. I was looking at a few things in asthma patients in Accra. The results was clear. More of the boys had asthma compared with the girls. It was more prevalent in boys than in girls. But we also know that as soon as they hit puberty, it reverses. We have more in females. So if you do any research in any environment and you compare your data, males and females, in adults, you have more females in there. So that is what happens. And like I said, we know that we believe strongly that hormones are implicated in there. And then especially estrogen is one of the hormones that we believe strongly is implicated in the precipitating asthma.
I see. So, two-pronged question. Does this mean that you can develop asthma later on in life, not from birth? And secondly, does estrogen in men also precipitate asthma?
Yes, you can. We have those who develop asthma later in life. And let me tell you something. So sometimes the person is already prone to it, but what is happening is that, I mean, they live in an environment where they don't get in touch with the trigger factors. Everything is fine there. All right. So you may assume that there's nothing there, but you may be asthmatic unknowingly. At a point in time,
low.
Exactly. When you come into contact with the trigger factors, then, oh, yes, there's something here.
I see.
Then a diagnosis, yes. It's also possible that if they had tried the diagnosis earlier in life, they could have found out that you have asthma. Because asthma, we have low grade, we have moderate, and severe. So it depends on where you fall in that continuum. All right. And yes, I mean, if you the estrogen levels do also play a part in males, but with us, it's more testosterone. That's the big boy in there. So yeah.
Okay, now let's talk about the controversial. You practice in a country that was one of the first to lead the way in this area. And you come from a country like me where cannabis is very, very much demonized.
Okay.
You are speaking to somebody who everybody should take seriously. This is why I took time to read your titles at the beginning of the show. So everybody would know that we are not conjecturing here. Now let's talk about cannabis and the relation to asthma. Growing up, we heard some of the people who had asthma, the one way of treating it was to smoke cannabis. Tell us, smoking cannabis or using cannabis, does it exacerbate the condition or does it help the condition? You are the expert. Tell us, please.
Let me tell you something here. When I have a lot of patients who are asthmatic and they still smoke, all right? Okay, I have a lot of patients who do that. Now, my advice is always this: when you have an attack or whatever, all right, and you smoke cannabis, now chances are that is going to make it worse. The reason being that, you see, when you smoke in there, those things could become like trigger factors. Like the way dust could make your attack worse, kind of thing. So it becomes a trigger factor. Now, my advice to them is always that if you want to use cannabis, and we believe strongly that there's a lot of publication under which there's a strong correlation between cannabis and the anti-inflammatory property in the lungs. There is. Okay. Now, what I normally advise my patient, if you want to use it, your best bet is go with the edibles, to go with the gummies, to go with those ones. All right. You will get, I mean, the cannabinoids, I mean, the CBD oils are there, the oils are there, those kind of things. If you use those ones, which are not the inhalational, you stand a better chance of getting better results than in smoking it. All right. So that's my advice to my patients. But like I said, it's a fact. There's a publication out there which, I mean, links this thing to anti-inflammatory property in the lungs. But I always tell my friends and my patients, and then in Ghana, it's illegal in Ghana. Stay away from it. If you find yourself in Canada where it's available, you can try your the oils, the edibles, the gummies, and all those other non-inhalable products.
So we're saying non-inhalable, but I've also seen some patients use, maybe not for asthma, but for other conditions. And so I'm asking if it's also applicable to asthma. But I've seen people use it in a form where they're not actually smoking it, but they kind of extract I don't know what to call it.
The active ingredient, the CBD or cannabinoids, yeah.
Kind of, but in a fume type of form, right? So it's not actual smoke. And I particularly saw this when it was a child that was using it. So of course they were not going to let the child smoke, right? So they extract that in some kind of form that where it becomes like some type of a nebulizer, right? Yes. But then the content is pure cannabis, whatever is in there. THC,
yeah, definitely. You know, I mean, my brother, I mean, nebulizers work very well for asthma. So if you can nebulize your cannabinoids, and we are sure about the amount that is getting in there, you should get some results with that. I don't have a problem with that at all. My only challenge is, I mean, if you are inhaling it, it could make it worse. But so if you're not inhaling, you have a nebulizer, you have the can going in there, we should be good. I should get some relief from that. But I always advise that. I always advise you need to talk to your physician or your healthcare professional about all this before you embark on that, because I mean, we need to make sure that there's not going to be any interaction between cannabis and whatever the gummies, the nebulizer, or whatever other medications you are taking. We need to look at that carefully, and you also be law abiding. Make sure that wherever you are, you do the right thing where the law accounts for.
Exactly, because before the revolution came in, I call it a revolution, right? In the United States, I live in Texas where it's still not legal, but there are so many stores that you can just walk in and buy it. I don't even know how that works because technically speaking, it's not legal in Texas, but there's no cluster of stores that you will walk in and not find a cannabis store in my part of the United States. I don't know how all that happens, but anyhow, I agree with you. You have to check the local laws in your area to know how to do this. And I've seen people move to other states just so they can take advantage of the laws in that state, right? If people would move to New York, for instance, or to, Detroit City. And even in Detroit, I don't know about now, but it used to be legal in just Detroit and not the whole of Michigan. The law is all kind of ways, but anyhow.
I mean, in my part of the world, it's easy. We just bomb into anywhere, whatever you want is there to buy and smoke and go away. Yeah.
And let me ask you again, just as a side issue right now, has Canada experienced any form of mental deterioration, medical deterioration, or social deterioration since it legalized cannabis?
I've read a publication which seems to point to the fact that it's becoming a problem along the line. I mean, and they always, at the end of the day, they will tell you that we need more research to prove it. So, I mean, it's just like you do some research, and depending on your sample size and the group that you interviewed or you gather your data from, kind of thing, you could have your results going one way or the other. But like they always say, we need more, bigger sample size. We need a bigger this thing to do. You know what? I mean, look, every drug has side effects, and this are also drugs. I mean, so if you're not using it appropriately, you're definitely going to have challenges. I mean, it's just like even Tylenol, paracetamol.
Even water.
That is it.
I'm sure if you drink too much water, you have some kind of effect.
Definitely. Yeah.
All right. Okay, Doc, let's zero in on some critical interventions. And this is what we're going to talk about. Asthma Ghana. Who is Asthma Ghana?
So Asthma Ghana is a charity. I mean, registered in Canada in Ghana. What we do is to help asthma patients, advocacy, looking at helping them with treatment, leading them to where they can have tests done. A lot of people don't even know where to go and do their tests. They don't even know what to do. And then we help them with all those things. And one special thing that we have done over the years, we're pumping a lot of money, is that, look, let me tell you something. If you have a child who is asthmatic and you prescribe an inhaler for that child, or you have an elderly person and you prescribe an inhaler for them, all right? One important thing about inhalers is that you have to get a technique right. Mm-hmm. If you're using like Ventolin, the blue puffer, which you all know, there should be a coordination between when you activate that puffer and when you start breathing in, which is not possible for a lot of people. So we know that the way out of this is to provide them with what we call spacers or aero chambers. That is a spacer. So in that case, you just pump the drug into the space there and you just inhale it normally. So you don't have to coordinate when you actuate the medication and when you start breathing in. And this thing, I'm like, you get about 60% better results than if you are trying to inhale. Somebody is having an attack and you expect that person will be able to shake their inhaler and then breathe out and start pumping that medication in and breathing in slowly. It's not going to work. It doesn't work. So Asthma Ghana decided that we want to close that gap by providing patients with the aero chamber for free. So we imported thousands of them and then we distribute them across the whole country. I have some of my contact in the northern part of the country. We just ship them to them, any part of the country, and we send them to asthma clinics, we send them to hospitals, we send them to centers like pharmacies where they see a lot of asthma patients. We just send them to them, but we try to make sure that the people who actually need them get them. All right, so because it's a lot of money. I mean, one aero chamber could cost, up to about $27, $30 kind of thing. But we ordered tens of thousands of this and we are distributing them freely across the country. So that is one thing we are doing now. And then when they talk about one of the medications that we use for asthma treatment, that's the inhaled corticosteroid. These are very expensive, so a lot of people are not buying them. So the asthma gets worse because they can't afford to buy them. We believe that if we make these medications cheaper for them to use, we will control their asthma long term. They don't end up in the emergencies. They don't end up occupying the space there where somebody will, the physician would rather have to extend to help somebody. So we have done a lot of training for pharmacists in Ghana to help them, educate them on how to help their patients, make sure that they can maximize the treatment for asthma, and also to help their patients take them through. And one important thing that we normally don't see, in asthma treatment in Ghana is what we call the asthma action plan. Now, every asthma patient should have what we call an asthma action plan. And that is something that I do for my patients in Canada. But in Ghana, you hardly find that. Now, when I did the research last year, 80-something% of the patients did not even have anything. They didn't even know about asthma action plan. And the few which were done were provided by the specialists, not even the general practitioners or the pharmacists. That for me is a no-no. Every pharmacist who dispenses asthma medication to a patient should be able to provide an asthma action plan, which becomes a contract between the patient and the pharmacist and the physician, knowing what to do when your asthma is under control, knowing what to do when you experience exacerbation, knowing when to do when it's getting out of hand. So you have the green, yellow, and red light kind of thing, tells you stories about what to do about those things. So these are some of the things we are doing, and these are some of the things we are advocating for, that the cost of medication for treatment of asthma should be low so that people will buy the proper drugs for treatment instead of relying on treatment that have severe side effects down the line. There's a common drug in Ghana where, this Asthmadrine and salbutamol tablets. No, you have an asthma. You want to inhale a drug that goes straight to your your lungs and take care of it. You go and take a tablet that goes into the system, it gets absorbed in your system, and by the time it gets into your lungs, all the side effects become prominent. All right. I don't believe that we should even allow this drug to be imported to the country because the side effects are, it's just not acceptable. But unfortunately, if the person cannot afford to buy the right medication, would you let them not use anything at all? So that is the conundrum. But these are some of the things we do in Asthma Ghana, trying to help as much as we can.
So when you say the cost of asthma drugs should be lower,
yeah,
somebody has to pay for that. Are you advocating for the government to subsidize asthma drugs? Is that what you're saying?
I believe. See, let me tell you something. If look, we are importing most of those drugs into the country. All right. If I had a way out of this, we would get 1 or 2 companies in Ghana to manufacture them. All right. If they need support, we provide them with the support. We provide them with equipment, everything. So they produce it. And once we start producing this, the cost of it is going to go down. There's no two ways about that. All right. That is the area I'll look at strongly. And then, NHIS is also because look, I can't blame them because it's an expensive drug kind of thing, and also think that some of the I know my brother. I mean, some of the profit margins on some of those drugs are ridiculous, right? I mean, yeah. So there are a lot of things we can do as a people, helping each other, making sure that we hold each other's hand along the way. Unfortunately, we don't see that in our society.
Okay, and then Asthma Ghana, it's okay. It's registered in Ghana and also in Canada. In Ghana, my understanding is that it's a group of, and you did mention that already, a group of people. Are these all doctors? Are they all pharmacists? Are they all who constitutes Asthma Ghana?
So Asthma Ghana, like I said, I have a patient support platform, and where we are nearly 400 there. And on that platform, I have physicians, we have pharmacists, we have nurses, we have asthma educators. We have, most of them are patients or parents of children who have asthma and all that kind of thing. We're all in there. You dump in your question there and you get an answer straight away. Now, when I started Asthma Ghana for the first 2-3 years, I had to wake up around 3:30, 4 a.m. every day, because the questions start coming around that when people wake up in Ghana, and it's 6-7 hours ahead of me. So for 2-3 years, I had to wake up. I had to be up by 4 a.m. every day to answer questions. All right. Now we have the numbers are good. We have a lot of pharmacists and physicians showing interest. So people just go to that Asthma Ghana patient support group, throw in their question there, and they'll definitely get answers, kind of thing. So I mean, that's how we go about it and help. And we are hoping to start asthma clubs in schools now. And then we also, I'm writing a book which is taking longer than I expected it to, for schools where the responsibilities of parents, pay the students, the teachers, their headmasters, administrators, and everything. So it's going to be asthma book for our schools.
So you spoke about the asthma action plan or something like that. Is that like something that's is it a device? Is it some notes? Is it a plan that you learn what to do when you get an attack and all that?
So yeah, so it's just like I call it it's a contract, all right? So we have it's a sheet of paper there. So we tell you that when your asthma is under control, this and this and this and this what you do. When you start having challenges breathing, the wheezing and whatever coming in. Now, if you're on this dose of medication, you increase the dose to this at this point, or you do this, or you call your pharmacist or call your asthma educator. When you get to the point where breathing becomes difficult, you can't catch your breath, nothing seems to be working, kind of thing, they know what to do. So it's like you sign a contract with your pharmacist, who normally will write sit down with you and go over the asthma action plan with you. Because on the asthma action plan, you know what your trigger factors are, what dose of the medication you are using, when to increase the dose, when to add a second dose, when to head to the emergency, when to call your family doctor, when to call your pharmacist. So that is what the asthma action plan is. And for me, virtually all my patients that I treat, I work with like in Canada, I make sure they have asthma action plans. But unfortunately, we don't do that here in Ghana, which I find unfortunate. So in all my teachings and all my encounters and training for healthcare professionals, and I always advise and say, look, it is very important. That could save a life, because your patient knows that when when I'm using this thing to check my breathing and it's about 70% of my max, all right, I need to add a second drug, or I need to increase the dose of this medication. Those are very, very important. They may seem irrelevant, but those are vital things that could save lives down the line. That's so asthma action plan is just like a sheet of paper that the patient carries. The doctor has a copy, the pharmacist has a copy, and you could revisit it after probably a year, 6 months down the line, and then work on it, a few tweaks here and there.
Very interesting. And you donated these items. You've been doing it not just once. You've done it a few times. They're not cheap. How do you fund the operations? How do you do it?
Yeah, I tell you what, as
$30 is a lot of money in Ghana, right?
Yeah.
For just one. And
so we ordered thousands of them. I tell you what, most of them is for money out of pocket. That is my passion. There isn't much you can do about it. I mean, one of the board of directors supported us some time ago, but this is continuous, all right? And like I said, that is my passion, and every life is precious, and somebody died because of asthma. I don't agree with. I don't think it's right in our community, in our society today. So I think that's my small contribution to that field.
Well, it's not small at all. But let me ask you, tell us about some of the operations in Ghana. Tell us about some of the beneficiaries. Tell us about where you've distributed some of these. What do you call them? Aero chambers, right?
Aero chambers or spacers, yes. And we have two types. We have two types. I mean, the ones for especially with the one we have there is normally adults can use them. All right. And there's another one that has that covers the nose kind of thing. Normally those ones are for babies and stuff. Yeah. And it has that covering that's for babies and the smaller ones. So you just cover your nose and your mouth and you just breathe in normally. And whilst you are breathing in, you are inhaling your drug and you get the results you want. I mean, can you imagine asking that child to just use the inhaler and then inhale it and coordinate when he actuates the drug and then inhales it? You're wasting it. Nothing's going to happen. And even when, even pharmacists, physicians, and nurses, the technique don't even get a technique right. And you expect somebody who is having a difficulty breathing is already shaking to do it right. No. So I believe that it's something that we are doing right. It's something that will have a long term. We've sent some of the air chambers to Kolebu Teaching Hospital, the pediatric unit. We sent to Tamale Teaching Hospital, Central Region, some pharmacies there, Tamale Hospital. We have Bolgatanga, I have some colleagues there. Tomorrow morning, I'm going to ship some 100 or 200 to the northern part of the country again. I mean, all over the country. I mean, once we get to know you need it, and we send it to you. We find a way to send it to you.
Are you monitoring though?
Yes, we
because
do.
one thing, giving things out. It's another thing, making sure that those who really need them are getting them. Are you monitoring?
I tell you what, most so the ones we sent like the teaching hospitals, that's something we let the physicians do. And all my these things are not for sale kind of thing on them. I've had some people try to play games, but hey, this is what it is. And can't be. So when we send it to the teaching hospitals, we leave them with the specialists there who, they see people who suffer. So they give it to those people. And most of the pharmacists and those
free, as you intended it to be.
Exactly. They write names of the people who use them. Some of them take pictures of it to send to me. So, okay, we gave it to this person. That's their phone number. You can call to confirm kind of thing. So those are some of the measures we put in place, even though it's tedious. And those are some of the ways we can. So that's how we monitor the way some of those things go out.
I see. Well, we were, for our audience, we were actually working with Doc at some point to go into the communities and give these things directly to some patients and all that. We're still working on that. I think it's something we will be doing.
Definitely. We'll be ever ready to partner with you and work with you, my brother.
Yes, by all means. Okay, so as we wrap up, are there any areas that we haven't touched that you think we should take a look at before we wrap up?
Yeah, I think some of we need some critical interventions in our part of the world. Okay, those are some of the things that I think that we should look at. Number one, the drug should be readily available and affordable. Very important. Number two, we need education and public awareness. So patients know where to go, what to do. And we need to train our healthcare professionals to help the patients to maximize the effect of the drugs they are using. Our public healthcare system should include a lot of training, a lot of this medication surgery available. And we need to also have guidelines which are readily available so that the guidelines should be there for everyone to know that this is what happens when you do that. And when you look at Mahama Care, this new policy, and which for me is one of the best healthcare policies since independence, taking care of chronic non-communicable diseases. You hardly hear anybody talk about asthma. They're talking about cancer, they're talking about kidney. Nobody talks about that asthma. So that is something we are going to push ahead with. You have to start talking about asthma. Very important as well. All right. So those are some of the things we need to do as a people, and the asthma action plan for me is very important. We need to get people to, you finish school as a pharmacist, you should specialize. We need to encourage people to specialize in asthma, just like they specialize in diabetes and other areas. We need to get our physicians to specialize in respirology, just like every other people do in different parts of the world. So for me, these are some of the things we need to do as a people. And we should be ready to hold the hand of our people who are suffering and move them along, instead of just thinking that we have arrived, to hell with them. No, it doesn't work like that. What affects me affects you. What affects somebody else affects all of us. We are one people, and we need to be there for each other.
Fantastic. Before we go, I've received a few questions. I can't read all of them, guys, but I'll share a few before we go. What kind of name is this? Sorry. My eyes. Okay. So the name is actually Rudolph. I don't know how I was reading anything else. Rudolph says I should ask you that, do you think some deaths have been caused by asthma but blamed on other conditions? What does that mean?
Yes, and yes.
I'm sure you understand what it means.
I understand. Yes,
people who may have died and it on something else, but it was actually asthma. I think that's what he's trying to ask.
I agree with him.
Okay, so the answer to that is yes.
Yes.
Okay, all right. And then now
I'll give you a typical example. I'll give it to you. Somebody has asthma attack. Instead of taking him to the hospital, you take him to a prayer camp and they tell you it's the devil. The person, so we are blaming the devil. We are not actually blaming the cause of the distance on that. And somebody, we don't even know he has asthma, he dies, and they will start talking about, because of what it's. Look, asthma has killed a lot of people, but we did not blame it on the right cause of death. Yes, that's true.
And again, from what you said earlier, right? Somebody could have asthma, and then that could lead to another condition that may actually kill them, right?
Yes, that's true.
Yeah, if you don't have enough oxygen.
Let me give you an example. So you have asthma. It has been diagnosed. You're going around with very narrow lungs. You struggle to breathe in. You're not getting enough oxygen to your brain. What could happen to your brain? When your brain doesn't have oxygen, anything can happen. So that person will end up with the aneurysm, will end up with any cardiovascular problem, and will blame it on the cardiovascular part. What actually caused the problem is the fact that the asthma hasn't been treated. The asthma is not under treatment, and it implicates and gets something into the system.
All right. Now says to ask you, if a pregnant woman, so the question is, if a woman is pregnant, does the fetus in the tummy, I guess, in the womb, suffer from an asthmatic attack? If the woman is having an asthmatic attack and the woman is pregnant, does the fetus?
That is true. So let's look at it this way. So when you are pregnant and you are breathing normally, everything is fine. All right. You are providing oxygen gets in there, and your growing baby gets everything, all the nourishment and everything from you. Now, when you start gasping for breath, you are not taking enough oxygen. Your fetus is going to suffer as well. Because through the umbilical cord, you have everything going in there through there to the baby. So once you start struggling, you start having problem, the baby is also going to have problem. And that is why we say that when you are pregnant and you have asthma, you're an asthmatic who is pregnant, please, there are drugs that you can use, get treatment so that you are protecting yourself and your baby. So definitely, yes, your baby could suffer.
Okay, and I can only take one more question. So let's take this one from Caliber. Caliber, let's take yours. So Caliber says, of course, it's going to be about cannabis.
Radio culture.
I said that sorry, so okay. Caliber says to ask you, sir, you didn't answer the question very well for him. He wants to know if cannabis helps or exacerbates asthma. If you have asthma, and then I think it's quite clear that you said don't smoke it at least when you are having the attack. It's a bad idea to smoke it while you're having the attack. So Caliber, get that straight. But we're going to get Doc to still answer.
Okay, so Caliber, let me take my time to explain this.
Mm-hmm.
Now, if you have an asthma attack, it would be a bad idea to smoke cannabis.
Mm-hmm.
It'd be a bad idea because it could exacerbate it.
Mm-hmm.
However, if you do have asthma and you want to use cannabis, your best bet is to try the oils, the gummies, the edibles. All right.
How about teas? How about if you brew it and drink it as a tea? Would
that is fine as well. My only challenge with the inhalation, where you smoke it, that's my only challenge. Every other means, the nebulizing and all those, I have no problem with that. All right. Now, because there is some data out there, research which shows links the CBDs, the cannabis to anti-inflammatory properties and we're in your lungs. So when you have asthma, what we see is that it's an inflammatory problem. So when you take any drug that can cause anti-inflammatory, open up your airways, then yes, it's something that can get you some relief. So I would say that from the data that's available now, yes, it will help you if you use it and use the right dose at the right time in the right environment, but it could also cause problems if you use it wrongly, the wrong type, and the wrong environment.
Especially if it's illegal in your part of the world. Thank you very much. Okay, now how do we join Asthma Ghana? Let's say we're listening to you right now. I have challenges with asthma. I want to join that network. How do I do so?
Well, it's just it's a WhatsApp group. If you go to our website www.asthmaghana.com, the phone number that the WhatsApp group that you can join, or I can make the phone number available for anybody who wants to join. You just send us a text message. We put you on there. You have any questions? You have people to help you, and so the phone number for Asthma Ghana is 054 682 9126. Let me just put in the chat was 054 682 9126. Yeah, that is the phone number to join our patient support group.
Okay, fantastic. All right. And then Bismarck says, very educative program. Doc, we thank you very, very, very much for such an enlightening discussion. We will be picking up with you again. This is not going to be the first time because I don't believe we exhausted all the questions. Today, we
didn't.
decided to introduce the activities of Asthma Ghana, right? Because again, and again, before we go, let me also ask you, are there any interventions to reach rural areas? Because, for instance, you gave the aerospace, machines to Kolebu Teaching Hospital or whichever hospital. That's people who are coming there, right? But there's somebody who is in my holy village of Gomajon who may be suffering from that, even undiagnosed. Is Asthma Ghana thinking of, and we already mentioned what we're planning with you and everything. But what I want to know is, if you live in an area like that, how do you benefit from your benevolence, for instance?
Okay, so what we do is that, look, if you went to a pharmacy and the pharmacist happens to be on our platform, they'll link you up with anybody. Sometimes they'll link you up to a physician who will do the diagnosis for you or have a chat with you over the phone and have a chat with you and arrange for you to get. And unfortunately, I probably shouldn't be saying this, but we've purchased medications for thousands of people across the country because they go there, the diagnosis has been that they have the prescription, they can't afford it. They contact us, we do that. Look, we need to open our nets wider. That is a fact. And now it's more like a word of mouth kind of thing. But like I said, it's a lot of money, which we don't have. It's just from pockets doing that. And hopefully one day we get some sponsors and we can extend our services across the whole country and have to the point where we can even have a proper asthma clinics across the country for people to just go and get services at no cost or minimal charges here.
And then finally, in terms of government policy, you've touched on some of them, building, or facilitating factories in Ghana that will produce the medications and stuff like that. I can also think of maybe cutting down the taxes, right, on the medications, for instance, to lower the cost and all of that. But generally speaking, government policy, government intervention. We've been speaking about your private intervention. What should be government's intervention in this whole?
Look, like I said, there's so much the government can do, and that's one of the things that advocacy is one of the things we do. We should be meeting some of the people who make some of these decisions. We have sent in this thing letters, hoping they will call us soon. I mean, we like in Mahama Care like this, it's one of the areas that we need to provide treatment for our asthma patients. We need to provide them with medication. I mean, if at a very good cost. I mean, and also if you are going to train specialists, which is part of this Mahama Care thing, they should be able to train pharmacists, nurses, and physicians to specialize in asthma care, and they should be able to, make sure that those drugs are readily available for them to use. So the government has a role to play, and we as citizens also have a role to play. And we believe that we are in between there, between the patients who have no voice and everything. We are their voice to the government, and we are hoping that we get some good response for them.
Dr. Victor Wutor. And if you want to know his credentials, go to the beginning of the show. That's another 5 minutes of us staying here. No, thank you very, very, very much. As I said, we'll be catching up with you again to pick up where we're leaving off today. And we'll be also keeping our eyes on the activities of Asthma Ghana. Please join Asthma. And we spelled asthma wrong. Guys, come on. One moment. Let's do this right now.
That's I didn't even see that. I
just noticed that from the morning. I didn't even see it from here.
It's my pleasure. Any day, I'm more than happy to talk about asthma. And look, you're doing a good job too, my brother. You're doing a good job.
Thank you very much. Thank you so much. And so, like I said, if you want to join that platform, I would definitely recommend joining the WhatsApp group, Asthma Ghana, on 2+233, that is 05 plus 233. There will be no zero. Guys, come on, look sharp. I know it is like spur of the moment. 233 54 62 no 682. Me and Kazasume de remember how 233 54 682 9126 and join the platform Asthma Ghana. It's a wide network of patients, pharmacists, doctors, researchers, whole group of, it's a support group, serious support group. And while we are at it now, if you know somebody who's suffering from asthma, invite them to that platform, please. Even if you are not suffering from asthma and you know someone who is suffering from asthma, tell them you know where they can find quality help. Yes. While you are at it now, I don't think that you'll be on that platform and then Doc will take the aerospace thing and go and give it to somebody else somewhere. I'm sure you can get one of those things, right? So if not for anything at all. But yes, I would definitely recommend joining Asthma Ghana. Dr. Victor Wutor, thank you very much for your time again.
Thank you so very much. And thank you so much to your listeners as well. You have a good one.
And you too, sir. Thank you very much for all you do.
Radio, culture.
Okie dokes. All right.
Radio, culture.
All right, we're transmitting online. We're live on iCulture TV. We're also live on Radio Culture. That was our first interview with Dr. Victor Wutor, who is an asthma specialist. Let me just put it that way. We were speaking about asthma this whole time. We will be bringing you our second interview in a little bit. In the meantime, let us go for a short commercial break. When we come back, we'll be bringing you our second interview.
Since 1994, crafting natural products with organic shea butter and red palm oil. All products are available on Walmart.com and Shopify, or visit our website at chrismark.com.
best kept culinary secret.
Demand that these two men be sent to the jungle for 40 days and 40 nights until they repent of their sins.
My lord, my name is Headmaster John Oriakpo Ezahapu Odakpo. I set the exam. This lawyer's son failed the exam. The next thing I saw was his father suing me to court because he's a lawyer. My lord, is it my fault that his son does not know book? This case is a stupid case, my lord. Is he the first person to fail exam?
My lord, before I proceed, may I introduce my humble self? My name is Everestus. Abagana, exporter, October, November, December, supplier, replier, importer, sequire, require, esquire, barrister of lawyer. My lord, my client, young Mr. Ajala, Ajala, is here to dispute the result of his primary one exam. Dear my lord, Tisha Dakbu ask my client here to name the animal that is the king of the jungle. My client said that nobody is the king of the jungle, and for this, Tisha Dakbu failed him.
My lord, is lion not the king of the jungle? Who does not know that lion is the king of the jungle? This is a simple question. He failed.
Do you live in the jungle?
What if it is? No.
Have you ever lived in the jungle before?
No.
Does any of your uncles, cousins, or aunties live in the jungle?
No.
Have you been an animal before? Maybe you were an animal as a child, and now you are a human being. So you know something that we human beings don't know. Answer me, were you an animal before?
No.
So which animal exactly told you that lion is their king in the jungle?
No animal told me.
So when was the lion crowned the king of the jungle? Who crowned it a king? What year was it crowned a king? Did you attend his coronation ceremony? Or did anybody you know attend the lion's coronation ceremony in the jungle? So that we can go and ask the person some questions.
No.
So, if you do not live in the jungle, your family members don't live inside the jungle, and you are not an animal, and animals did not give you this information, who then told you that lion is the king of the jungle?
That is what people used to say now. That is what they wrote in the book now. The book we are using to teach the children.
Mr. Dabo, which of the wild animals wrote that book?
How can an animal write a book? It's not an animal. It's not an animal that wrote the book now. It's a human being. It was written by Mr. Chichankponoma.
My lord, may I call Mr. Chichankponoma to the witness box? Dear Mr. Chicha, are animals even aware that lion is their king in your book? Did you inform animals, or did animals send delegate to the meeting where you and your publishers decided that lion is their king?
Your account is
no. The animals are not aware.
Is lion even aware that you people made it a king of animals? Did you tell the lion when you finish this meeting, this publishing, or when you finish writing this book? Did you inform the lion? You say, bro, now you are the king of animals, so take care of them. Did you tell the lion anything?
America will know.
No, we did not tell the lion.
My lord, I demand that these two men be sent to the jungle for 40 days and 40 nights until they repent of their sins.
By the power invested in me, I hereby sentence the teacher and the man that wrote the book to 40 days and 40 nights in the jungle.
Yo, Russ.
Yeah, my brother.
It's time to go back home.
It's
time to go back home.
Yes, see? With all the stinks, that happiness, Zion train is coming, jumping.
It's been a long time.
See.
This is your dong, you know. Have to go home. Huh? It's
Time
time to go.
It's
time.
Oh, my people are balling. Come on, yeah. Why, yeah. Zion train is coming. Jumping on the train, yeah. Zion train is coming. Oh, yeah. Zion train is coming. Jumping on the train, yeah. Zion train is coming. Watch out. In the gully when me live, me see me people, them a ball, Mr. Big Man, Lord, them not care. It's a pity when me see the ghetto youth, them a cry, Mr. Big Man, Lord, them not care. Yeah, the youths, them balling. Why, yo? Yes, it's time. I got to move. Yes, my people crying. Oh, Lord. Yes, in Malata. Oh, yeah. Oh, Lord. In Nima, Shukura, Mamobi. Why, yeah. Take a look, my people in Medina. Oh, them crying. Why, Zion train is coming. Jumping on the train, yeah. Zion train is coming. Oh, yeah. Zion train is coming. Jumping on the train, yeah. Zion train is coming. Watch out, my people are balling. Your separation upon the country, Mr. Big Man, Lord, them not care. Why, check out the ghetto. Why, my people are balling. Poor people, them striving. Take a look around the ghetto.
All right, thank you very much. And we are back and we are all set for our second interview. Newsroom, background, please. Background, and get the photo of Mr. Solomon also ready for me because he's driving at the moment and he's not able to join us on TV. But at least we will have everything. The most important part is what he will say, right? So we will have the benefit of that. Thank you very much. And let's have the background, please, quickly, so we can move on. He's waiting. There you go. All right. Thank you very much. And let's welcome Mr. Solomon Owusu, Communications Director for the newly formed United Party. Mr. Owusu, thank you very much. And we know, say you are very busy, but you are making time for us. We really appreciate that. Thank you very much for joining us today.
Thank you for having me, and good evening to you. It's evening in Ghana. I'm sure it's afternoon in the US.
It is afternoon.
Good afternoon. Yes, yeah, good afternoon to all your listeners.
Thank you so much. So let's start the interview by asking, you were a movement, right? Now, first of all, has a Casabia Ghana for Tibia, you can't be waha into the patch or the baby, I know what come in. Yo, now, your movement, to say, you've matured or metamorphosed or transmogrified into a full-fledged political party. What informed the decision to move from a movement into a full-fledged political party?
But as far my main fun is I try you free NPP mono in 2023 no. Now you put a party a be a political party. Then yeah movement be another year person. And September, early September. And I check September 2023 to the next election of 2024 December now. Yeah, because a file documents with electoral commission say party bar. A better ansana party no in the final certificate. A better Abuama a candidate to be a contested election 2024 and you're run like and the Political Parties Act, the Electoral Laws of the Land, who said, the easy route out, the shortest option. I the candidate to run and to be a contested election 2024 as a presidential candidate. And you must say, your man could not a content as independent and no requirement, and no so.
Okay.
And president of the course an independent candidate, it could be antanechi. And a general ma, Yakofa, idea friend movement for change. The movement for change in any political party. Now, more or less a pressure group, a special purpose vehicle. And then by not a tie oral and the independent candidate Chanechi. Said a bear or call constituency toss near ye, at least obey any power. The can campaign. Now, a real election 2024 no every year since December. Not just they will say go back to the original idea say nanka party na yebetino. And at the same time electoral commission declare results. The AI say we have been doing back and forth to the electoral commission now you submit your documents for the political party. And then I charge on the 3rd of October 2025, Electoral Commission and buying the provisional license. To me, your political party, partially or more accepted. Now, establish your offices across the country, they manage the final certificate. And you can where the background to what
I see. Not to say, they who know, and Ray and Richie, a kind of saying, provisional license, and I'm more Yadama must say, full license.
The Electoral Commission or my 2 licenses, or my provisional license, or my provisional license, they can say, on the person who offices across the country.
Okay.
Now, I feel executives funding, you have to get funding members across all the constituencies. And no, you have to come on more offices now on the final certificates.
You can say funding members are dues paying members are not say bankrolling members.
No, be our Ghana near where you fear you about what or person near party or JD, see you are which are a founding member. Say, why I mean, we interview our own constituency of Ghana. I'll condo you, Pida, Omiatia, Nasia Show, Nasa, Modern Bono, a committee level, so this was eventually a founding member of the very constituency, Ottawa. Cannot go for a voting age, normally about 21, I think. I'm Ghana for 2 years founded, but I in place. It's a matter of say you put the documents together.
Me sure say you say a Berman since so one son our ham. Me GD pass as an experienced politician of Alan Martin's caliber no. Or by one in and son with here with 29 said or by forming political party. I have no doubt about that at all. Yen share yen ko and more anthem cry you know other parties see me be tongue in cheek.
In fact, you know that I say one the MVP and this do a high life out of our new and then when the answer was it's going to say two corruptions, sister.
Anthem no quite corruption, sister.
Two corruption.
Okay, so by share, you know, a few, you know, brass tacks questions. First of all, me to say lawyer Nochi, me just so lawyer Nochi, a famed historian in Ghana at this time. Great. Me an interview back when he made a certain point, which I definitely says I have to bring it to your attention to get a response. Or say the MPP, you know, is out to punish. I mean, the UP is out to punish the NPP with its formation. Please react to that for me.
Let me say, sir, yes, you have a political party to win political power. Mm-hmm. And then to win political power, it means that one of the duopolies, or say, also for short. And it is San or who say, Esa say, and you say, Babaji to me, not to me, is within reach the year. Not just a dear walk, and yet too far off any objective. But one of our stated objectives is the person it displaces one of the duopolies. I know your first here. In fact, not very party, the criteria say, you person, one of the duopolies. And then, you know, say, one of the duopolies in the year. Not definitely. NDC and
there should be a casualty.
Yes. Now, majority of our members now, every day, NDP stock.
Yeah.
And you know, Sanaya ni Bushiane, acquaintances, Ubia, no pay us them to about my NDP, and they have performed the UPR. Obviously, the casualty would affect the MPP. They will be the first target. And Sana, and the MPP, no one's going to be disgranted. They are very dissatisfied because of the way manner party now Gasano or treating go for. And then one was said, since the party by response rate across the world, and yet Ghana across the world, Ghana for a bargain injustice. And on your wrong, but for all you know, no, and if one is a crown, a test of the kind, if you don't want the crown, I catastrophic. And that's almost a position, you know.
If you went heavy.
The level of credibility, among who said, the interim executives are you know, and more and with him together with the policies, your vision, any mission, any key objectives, another key policy directions, and more amount of so be said, given the opportunity, no. Yes, you be travel be something different. Sana,
yo, now you might say we a centrist party. Now, in Ghana politics, and then how attractive is a centrist party? Who's a Ghana very sharply divided along MPP NDC lines? Now here comes the third force, and my title for today was. Is the UP going to be the much awaited third force now? But Cecil Crowd also put them on third force, so one of the duopolies, right? So that has been answered for me quite clearly. But question maybe Sandy said, how attractive is a centrist party in Ghana today, considering the politics that's pertaining?
So first of all, Ghana for the two political parties and this how many clear cut. Your friend is saying, for want of a better
majority.
It's a vision, and I said,
clear cut vision, okay.
Yes, and as a state of political position. Omuni umusa omwa. It was the way and another way. Where and this Becca somewhere center left, and the Becca somewhere center right. So just here. By any philosophical hard, only philosophy, that's the word I was looking for. Any philosophical position of centrism, no. ASF. Offer UP, the original UP now a more conservative party. Now I believe in the free market enterprise. Say the private sector is the engine of growth. That was the original idea of the UP. Now this UP, antagonistic towards the CPP in those days.
Yeah.
And those CPP in those days, Kwame Nkrumah and Banomi a center left. Almost is there. Bibiana was the state, and the leading. It was the state farms, state this, state that,
state housing corporation.
Exactly. Now with your centrist approach, you believe that you have found the old goodies or the good policies of the old UP. Anna, you took the bad ones, happening. Just being antagonistic towards the CVP, it's not relevant in today's politics because you need everyone to build Ghana. And yes, you can first CPP ideas to the upper. Say the state must as it were, provide its original behave in its original function. So on my biano, it provided the enabling environment for the private sector to thrive. And this are buying the lead business. I buy the other say, the institution interest rate for. The institution taxes are relatively cheap. And I said, no. The institution of that Burma, the much needed infrastructure, acquire schools for home, hospitals for home. Not private sector, no. I take you over. Not to be Amma, Ekuma Abai. Because Ghana, Abai is unable to employ more than 7,000. But the population of Ghana is hovering around, almost 34 million. With 34 million population, you are likely to have about 50% of your population within the adult bracket. It is all fine, 50% here within the adult bracket now. That is 17 million people. A B equals school, a B here. Technically, you have about close to 15 million people or say Obunya Dumani. Short term. Other public sector need to know more. And it's all your banners when you embrace that. Then the concentration must be on the private sector.
Quickly, hold your thought. Don't, I hope I'm not distracting you. But what will be the reaction to say people are not too much in favor of the trickle down approach, which is that let's focus on giving the wealth to some people, let's say industrialists, people who we will enable to start this industrialization here working, for instance, and then we'll wait for the benefits to trickle down to the ordinary man. There are people who are not too much a fan of that type of approach.
Well, these are people who are selfish. In the system we are operating, a few people have hijacked. They know that this is the only way out to make them more minor survival. But it's also almost and therefore, you see, it's in the interest of a few people in this country. Say majority will be poor. It's as the obvious as a man, or more for the job. They are irrelevant anymore. Unfortunately, that's the stark reality. But you believe us say yes, I did no one. Or my be India. There were a bush of Kobe. I said that this come up by the believe so many new business here. No, but they're not a map. To
be honest with you, Solo, even America, is a capitalist, whatever. If you really check it out, it was the Rockefellers and those kind of people who put their money together. The Brooklyn Bridge, then Musi and there are people who put their money in there and make sure it happens. And then there are people who also had the knowledge. It's okay, whatever. Now, keep your bet said they wouldn't contribute that. So, anyhow.
That is the philosophy. That has been the philosophy of the movement for change and now the UP. And even when you were in the MPP, you did the great transformation plan. That has always been the philosophy. So most first got few businessmen, no
How about say Komoye Sano? Na government was stake in that, right? And yes, Sano, there's a danger of enriching a few people, you know, versus everybody else. So,
no, but that is why we say first of all, I buy beer technically in Ghana, no, close to 25% in every company if it is private.
Okay.
Because the whole year, at the end of every year, no, every company is supposed to pay what you call corporate tax of 25%.
Okay.
It is in your interest that there will be businesses who monitor the year. If our system is not structured, if our system is not formalized, that there is no way anybody could evade tax. America would pay. So we pay tax.
For the most part.
I buy the car, they buy the amount also. And that's what the amount through. And then you have equity in the business. That's the first thing.
Okay. Okay.
What you say?
All right.
So, because the amount, it is coming at an interest rate. Sometimes you convert the interest or the amount into equity. Or better say, you're more best if you have a check.
That's
so,
right.
You're not buying this car. But a buyer will not give it to you at a ridiculous interest rate. I remember watching them.
Matthias.
Very low interest. All the year, ama. Your Fenipa, Uncle Funya,
tax.
And then so you the trickling effect, you know, it affects the entire economy.
Okay. Yanko back to the UP, you know, and this formation, no. Me sure say what is some of this, and I'm sure say you probably have treated it with disdain. But let me ask you again. At least I'll try to rephrase. Edin UP, no, couldn't you have chosen a different name? What informed you choosing UP?
Because we believe in UP. We are UP traditional. We are UP traditionalists.
Okay. So and already, I'm finding, some dichotomy there because first of all, you are telling us that we're centrist. If I'm not center right or center left, or if I'm center left, right, you were center right. And you want to move to the middle, and you want me to move to the middle with you. But now again, you are clinging on to your tradition, which is UP, which is center right. Why?
So that is why what they say is UP and the plus we are the UP plus is an enhanced version of the UP. Yes, we start here now. We can be say all the good policies of the UP. Anna, that put your name, everywhere. And the money UP plus because all win elections. All what is good from the center right and good from the center left. You have to say they change the original UP. And M1 center left ideas and also entering for one during the day. And nothing they say about me. And a UP by a carrier the acronym because a UP plus. Meaning I have iPhone 3 plus, 13 plus. It's another 13 Pro Max, an enhanced version of 13. So, yes, we believe in majority of the policies of the old UP. However, we believe that in the modern day politics, you cannot use that alone to build Ghana. You need other shades of opinion. Divergent views are making a memoir. Ama or minor can name fast. Hence, the UP plus. The UP here, young family members, you believe in majority of the ideas in the UP.
Yo, now. My intro video. This is why I really needed you on TV, so that you see the video. But at least you can.
My party at this stage. So.
It's been quick commercial break. Nanka try signing on and. Yo. But before I record them, you were no mami ansana na yem fan kobe pachopi. UP no a certain history, right? The imagery for it, whether it's perception or reality. There are people who believe say, okay, say UP, Nana Drianko, they almost to bomb, Crime and Chroma, stuff like that. Of course, there are also the good parts that you can also mention. But say, okay, say, centrist party, a new party, people to join. Don't you think that there's an imagery problem there? Because once you say UP, now say maybe and Chroma is Caribbean, it would need a lot of work to start convincing me, say, oh, that's not what I mean, but come over. And
so, until I may change your message, you're friend UP plus.
Matthias, but I just want to talk about the imagery, the perception.
So yes. So, can you understand? You have two the bad side of the UP, no, actually.
Okay.
In fact, and we did a year launch party, no. Connected now. There was no way UP air launching and they are now in the program. They are seeking for the party. But yellow really a party. There was a CPP general secretary. Interestingly, they invited every political party, but they were the only people that came.
Oh, wow.
They understood.
NDC didn't come?
NDC didn't come, NPP didn't come.
Wow.
None of the political parties came, but the CPP came. Short as here. And now instructive because they understood our concept. Say, look, it is not about the old things that happened. They believe that now we have to collaborate more and work. As I said, when we started our politics, it was the UP and the CPP, that was the case. Now, CPP more or less is collapsing. Virtually collapsed. UP is a new cry. Where are we? I'm going to MPP. Where they are another people's party. And yet the new patriotic party cry.
Radio, culture.
No, we just back the political authority of this country called Ghana. And you say, I don't want to have a boom. Teach our perception to cry there in your cry.
In your cry, okay. Yo, Bepacho, you have a quick commercial break. Hope say over Basona, you are picking up from there. I have a video to show you that I need you to react to for me, please. But before we do that, now also let me draw your attention and to the attention of our viewers and listeners. To say, besides CPP showing up for we say no, in Alan Chamatin's speech, no, he actually gave tribute to Dr. Kwame Nkrumah. Just a note. We will be back after this commercial break, hopefully with Solomon on TV, and then we'll continue from there. Thank you very much. We will be right back after this commercial break.
Since 1994, crafting natural products with organic shea butter and red palm oil. All products are available on Walmart.com and Shopify, or visit our website at chrismark.com.
Blood of the slain will never be in vain. Never. No. We don't want to see no more people dying. Zion Yahweh. Whoa, Zion Yahweh. Whoa, Zion Yahweh. Whoa, Zion Yahweh. Yo, listen, man. My name is Ja, beloved. You can call me Kwesi back when the occasion calls for it. You are watching iCulture TV. Keep it locked. iCulture TV, Africa, from an African perspective.
Thank you very much.
United we shall stand. United we shall win. United
Whoa, give it up.
United we shall stand.
Yes. With a hand of clap offering, let's welcome on stage The man that the world wanted him to be our trade boss. The former Minister of Trade and Industry, the special one, the analyst, the cashman to the podium. Thank you.
Today, we are ushering a new era, a new dawn in Ghanaian politics. A new dawn that will end the divisiveness, acrimony, and rancor in politics in Ghana. A new dawn that will also end the duopoly in Ghanaian politics by offering Ghanaians a credible alternative and eliminate the culture of winner takes all. A new dawn that will bring about economic transformation, which will translate into massive job opportunities, usher in a golden age of business, and also create prosperity for our country, Ghana. A new dawn that will mobilize the collective strengths and talents of all Ghanaians for national development, irrespective of age, ethnicity, religion, or political affiliation. A new dawn that will promote accountable and transparent governance and introduce a policy. A new dawn protect the environment and promote sustainable development. Distinguished ladies and gentlemen, this is what underpins the establishment of the United Party. The UP, as you've been told, is a broad-based, and every word here is pregnant with meaning. The UP is a broad base, that's number one. Two, and then it seeks to build a united Ghana. The vision of the United Party is to make Ghana the economic powerhouse of Africa by 2040. By 2040. And that is what we call Vision 2040. And we are branding this as the Paradise Project. So by 2040, if the people of Ghana, by the grace of God, install us in power, then we promise them that by 2040, Ghana will become a paradise. Now, you may articulate your vision, but what is it that you are going to do to realize your vision? That is what your mission is. And our mission as a party is to build, one, a united, peaceful, secure, and prosperous country. But what is our vision? Our mission is to provide equal opportunity for all Ghanaians, not for some, but for all Ghanaians. What we have been witnessing since independence is that the opportunities are open for only a few people. The United Party is going to change that dynamics in Ghanaian politics. We want to introduce a culture of discipline in all aspects of national life. We are very indisciplined. If a function is supposed to start at 10, they assume that everybody will be late. So we should come at 11 o'clock. We want to unleash the entrepreneurial spirit of the Ghanaian. What makes Ghanaians different is because of that spirit. But our politics has dampened that spirit in us. You need a new party that will unleash the entrepreneurial spirit of Ghanaians. Number 8, we want to promote free speech and freedom of association. This is one of the core values of the old UP. That is why we are talking about UP. But it is UP plus, because we've gone beyond even the values of the old UP. That is why we call ourselves UP plus. You've also been told that our values are based on the original UP tradition. But we have moved on further to become center party in the middle. We bring countrymen and women the great transformational plan which we developed under the Movement for Change, and which has been widely acknowledged all over the world. all over the world. If you get the chance to read the GTP, you make sure that the United Party becomes the next government in Ghana.
All right, let's pause there. We'll come back to the video because there's still some part that I need you all to watch and listen to. But let me take the time now to welcome my guests. Mr. Hobson Adoye has also, and of course, when you say we were on already with Solomon Owusu, who is now joining us on TV. I think he's still in his car. It's a bit dark, but please bear with us. Yeah, as for Hobson there, Hobson, you have to introduce me to your tailor. Oh. Seriously, the way you are going.
Good evening from Ghana.
Good evening. Thank you very much. But anyhow,
it seems I don't know. Your voice is very low. I don't know whether the volume of your microphone is down.
I am all the way up. Please check your end instead.
I've also given a full volume, but
so are you having the same issue?
Yeah. First and foremost, let me just apologize. It seems it escaped me a bit. Your producer could have elected me earlier on the day, and it's now 6. Sorry.
Not a problem. Not a problem, crowd. Better late than never. You know, and we also
it's now 6 o'clock, and then we have a executive meeting 6:30.
Oh.
So I can only do about 10-15 minutes.
Let's put the best
so
in
that
here.
I can.
Let's put the best in
If
there.
not, I decided to join so that it will not be a disappointment and push you this or that. So at least 10-15 minutes will do.
I appreciate that very much. Thank you.
Yeah.
So let's go straight to it then. So we have already answered some of the questions with Solo, who I believe will be joining us back. But just so we don't get repetitive, let me ask you some of the questions we haven't already tackled. Okay. We've already read about the Great Transformational Plan. We know what your party is about. You've also described yourself as a centrist party. As someone that maybe Solo and Sana Yeko breaking this, when somebody hears UPR, not just call the old UP, so if I'm in Chroma aligned, it initially doesn't sound attractive to me until you have explained what your actual vision and philosophy is to me. What do you think about that?
Okay. I'm finding it difficult to hear you, but it seems I got a little. I'm trying to see if I can switch to the other phone as we are speaking to see. Maybe I may get the decent clearer there.
Okay, I can hear you very well.
So let me just try and see. Continue. Okay. Just a moment there.
All right. Okay.
I will go off from this one.
Okay.
Go. Now yes. I can hear you loud and clear.
Fantastic. So it was from your end.
Yeah.
Okay, Mr. Adoye, thank you very much for making the time for us. Okay. Etinami Bisa said, when somebody gets the name UP, right?
Yeah.
I said, oh yeah, in Chroma aligned that. Now I feel more centrist party, new party. I feel more tries more catch more for attention. Don't you think said the name UP, no? You have to do too much explaining and some amount for say, oh, okay, this is what you mean.
No, it's like your friend Obiya no koko di bonia. Does it mean say we share your Obiya na say say no so or the body of one there be so no. And then yeah target the youth. And the youth know how many of them know UP. So what can say UP rather they don't know except or more school more read about the political parties in Ghana and in the Kakikam. That is our way. Now, yeah, focus and say, look, let us build what will unite the nation. And Osha, yeah, mission Umkrana. I mean, United Ghana is what we are preaching. And they say, Sadia, then let us form a party, ever go along that. It's a united party. That's okay. Let's now man for grab here the Dini Bisham United Movement Party, Nini Kaika home, yes, you would be. Yeah, pen United Party Nisa. Send your bay. Aside that, what targeting penny for Nanka most of them have some kind of belief will be trust to be in the old UP. And this uncle for no who say, and MPP party now veer off from that core values now. Na UP no nti almost te abons o money age UP na badia and ye be kwa kodwa ne nyina ya ye ho look, Friday I was on my way to Metro TV in the afternoon. Ana menya message from Openi pa vat fan say or your hinimpo just send in some bi pa and was sending me message. What's he saying? I'm going to sponsor this party.
Wow.
So draw your budget for me. I was just shocked. What's it being your budget from now to 2028? No one sure how it's going to sponsor. And I'm catching say for now. You here, you're working on our offices first, regions, and then the constituencies. You hear honoma then ne ewo honum ne ade. What's it mean ho ayimra? So I just say. I reminding Crawford say penny for party be or honum and the Karika home. So on that, I don't know. I think we don't need too much explanations because political party be a piano and this MPP, PNC, CPP in the Karika home. I don't think it was something to be explained and some Obiba Jania or Jenny.
Except say in this case, now you're a bit peculiar because Moog claims centrist, right? And still you are hanging on to a center-right ideology. I mean, not the ideology, but at least that the image, the philosophy, It's yeah.
Mm-hmm. Yeah, because centrist, I don't know what to say. We are not entirely believe in the center right. Not entirely believe in the center left. Exactly. Are you getting it? Exactly. There are certain things, there are some values in center left that we believe, we'll bring it there. There's values in the center right that we value, we'll bring it there. So we are going to look at the quality of the so great values are Ghana for I don't know.
With the time my movie on from maybe some other person which I think are more pressing. You can't regional offices near there. So share the formation of the UP now. Many of the founding members now. And you can help me here. Does it have a good regional representation in the leadership?
Why not? The national chairman is coming from the north. The general secretary is coming from the Ashanti. The national organizer or the field operations is coming from the Volta region. Osha Yakani saying the women's organizer is also coming from the north. Osha, the communication director, is also coming from Central and then Ashanti. Osha, the deputy, from Central. Osha, deputy general secretary coming from the Volta region. Other officers are every west near the day. So regionally balanced. I can assure you, say your frontliners no should come out. You will see it's not a particular region or tribe that are fronting this particular I can assure you.
Okay. Now during the launch, you had something about Vision 2040.
Yeah.
Next I said, in 2040, we will see some great transformation, like very visible transformation.
That's
However,
right.
Practically speaking, it's going to take you a little bit of time to garner that energy and the base to win power to make that 20,
I don't know you're wrong. You're wrong assertion.
Okay.
I will not take you far. When you go to Benin, what try to go power to Benin? What can say what driver kwa 45 minutes 1 hour what drew honum? Ebiesida. What you say? Two parties were ruling that country now for some time. And at 2016, send your two lunch mantia or mudin and ya ebi to obi or honum. What is the name? One be referred the first name by Tolon. The son name near Tolon. I know move out. He said no, we call as independent. Now man force reno said no Mosra and Chairman. You have to have no winning. CNN I showed documentary on Benin president, independent president, it take you over. Great transformation when it comes to health sector, education, all other sectors. Great transformation. So it's a Benin Timaya
with the economy.
Yeah. It's a Benin Timaya. Far from Ghana. So but you believe when he said, look, we are starting, let us build. That's why Alan was careful when he was speaking. Was it should Ghanaians give us the power 2028 or 2032? Okay. By 2040, Ghana must change. Look, leaders are or more effective change, and yet how long are or more so and one is what make a bold decision from the beginning. So what call industrial revolution we say yes from year 1. Let us move into this aggression in the year would be shemuno ebema man for who say this one is serious. By the time I will be real 4 years, no one say now I started. Even so free power crana a difficult say we be to my baby drawn back. Say oh yeah. Nasa anye papa na kwa ya artificial tina eno na ya na etai etranketi ene na ekai ka ho so na je no eje de ye bodata yi ni se China for timaye Singapore timaye Malaysia mo timaye ne na ekaka ho a adenti ne ntimi nye ebre bia was in Dubai ane kokoshia Sheikh Phobia ne ye di nkomo ye ya na mbisa omo what look over Dubai we don't have anything but what we have is the leadership. Or more quality leadership. Or no, or ye juma ni se or the jadin. Or ye juma se or the pesika. Et your person ye juma ni se nipa si machine yes a bridge way. Nipa si machine si sa that way. And in the kaika. And no, anama baby a Dubai a drew. Oko a croti se Rwanda. And maybe I refer to that place in the kaika. Paul Kigami. Or just so a democratic sao. What started say or more green city? What the people to hold here to a police for Kawachi, our bonting, near more senses I don't know, near Sa final, and in the Kaika, and no, a Kenya or more, a mene or Mudim Brasso. Better before no, you need someone who come and then implement some kind of radical transformation.
Yes.
A bit mama or minus is Obi or Hodoma, then the this was she, and so no, yeah, the 2 minute man, maybe I know what time.
We saw one exams challenge my team, but the money and I will bet his stance.
I say, and Crawford, we didn't know, or more stronger than Yena, hey.
Yo, Mommy, this is my next question, Hobson, please. Now, okay, Auntie, one of the key things that I also picked up from this Mr. Lanchawatin's speech is say they're going to promote, they're going to eliminate the culture of winner takes all.
That's right.
Does that mean, sir, the party is open for strategic alliances? And
why not? We are even praying, your constitution, review na ekosono. And Combes Sano say, your cocotuaba. They be a party be anya 50+1 now. We don't need to go and do rerun. As I said, ultimate formal alliance with the other parties. Or they say, Drew Suna say, the two big parties agree or more common hub no their formal alliance. So be it. Say, Basse, or the smaller parties be never formal alliance, no more than 50+1 now. That just say, it's a Bassa now. you get the talent to run the country. So last time me example be, and the NDC war abaim. Obi ti say Professor Frimpong Boateng. Yenim say a bakuma ho nsɛm a wɔyɛ expert pa. In fact, wabra wo Germany no. Part ahead ne say hospital no ye adwuma no. Emrofo no duru ho na se ono ni ho a, omo mpɛ sɛ obi abɛhwɛ omo. Obi apɛ Professor Frimpong Boateng a bibini a ne body tuntuntuntum omo ono ana emrofo no pɛ sɛ wɔsa wɔnyare. Saa nipa ne sei ɔte hɔ kwa. Because our party be and then the party and the war by mu etino ya jai amasa talent no ye waste ni keke so on etino Alan e wo believe be last obi ka asem bi MPP ni bi enra e wo news file was say emre bi say Alan e resign ye na Dan Rocha e tro letter e ka say ma omo nso so no so was say reason dia Dan Rocha e ka sa no number one reason was say Alan think about Ghana too much than the party MPP. Second, I know it was and I'm say Obi edwene Ghana ho esen the party a. Enye say nipa no and the man lead the party ana. Send the be Ghana because Ghana ye na party so ye and I'm one.
Yeah.
Party ye na Ghana.
To candidate we are Ghana na for na wokoton no amo.
That's right. That's right. Eti papa ne de or no
have been an advantage because we can say oh nipa way even though are within the party no whatever no ya de ne kwa Ghana for no be so ni more that should really be an advantage if you ask me.
That's right. Yeah. Yes, yeah. TUC for Allah ya ni presentation yeah. There's some penifoni bi say this is the best man to lead the country. But as to how Ghana for beto abana mano anaka. So on yet, Papa ne kasa wuti na who say yes. I know so no. Wanye can say chew and poor people. Why a practical person. When him say the life umuno. Why a corporate person at age 22 no a general manager for UAC departmental store and Unilever. Any other. Na wababe ye consultant. Ama UN sa eka kakra bi nko obebeye the fourth most powerful person of this world because oye UN General Secretary World Bank IMF free one more the next powerful yi WTO World Trade Organization se enye MPP fo ya bi ene free Ghana ko war na se kire African president a nka Alan nka 2013 nka obeye the president of WTO so ne no. These are some of the things I think say ye proposal send ye beya say ye kase ye oman na obia ka ho bia ye bekọ ye nim supposing say ye winner takes all free one ye inclusive government na NDC na waso sisi yawo watwe MPP for bia omo wonim de be 5 watwe ebia CPP be mienu bi PLC ba ku bi we ba ku no mo hyehyem that nyina eye adwuma. Do you think say koka ekoso ye bete because say be a road project na say ye fa ne say MPP ni nekura na waye proposal na eko parliament don't you think say all MPs no wa mo be support because wa mo pese o mo nipa no so ye den SOCD all other parties you be part together you be burden of my Ghana than tell ye say wa utimi hu say ade we di o mo aye efe obi say oh time papa all because of politics so on there no utimi say ade ye white pa was it there be media be hu no black basa ye nkoso as o my
but you interest quickly point the mama person reacted to mommy but you right after the video.
Because we think about Ghana first. That is why after the elections, in spite of all that happened, which I've explained to you, I've only opened the lid a little bit. In spite of that, because we believe in Ghana first, I went and visited the president and said, here you are. This is the key to the transformation of Ghana. We believe in Ghana first, so make use of it. And it reinforces our belief in Ghana first. Now, if you look at the GTP, I'll just say a few words about that, because I want you as Ghanaians to appreciate that it is not just a question of forming a new party, but the policy initiatives that we have espoused are relevant today and will be relevant tomorrow. That's what we are. And then also focus on traditional and herbal medicine, whether we like it or not. Currently, 60 to 70% of our Ghanaian population, they only use herbal and traditional. Are you aware of that? So we must make sure that we reinforce that as part of our health system. Public housing, it's also very important, and I think that it's a priority that way. Now, the United Party, I want you to listen to this very carefully. The United Party will also aggressively promote a Pan-Africanist agenda, because like Nkrumah said, the independence of Ghana is meaningless unless it is linked with the total liberation of the continent. At that time, he was talking about the decolonization effort. Now, we've gone past decolonization. But for us to become a prosperous continent, Ghana alone cannot be prosperous amidst poverty in the continent. So we have to tie our approach together. And that's what Pan-Africanism is about. And
Hobson, for me, this is the best part of Mr. Chamatin's speech, the end part, where he's talking about Pan-Africanism. Because first of all, UP, but he's quoting Kwame Nkrumah, and that is going to reinforce the fact that this indeed is a centrist party. Mepacho reacted to Sir and bit another question maybe from this clip here, but Mepacho reacted to that. The Pan-Africanism or espouse, it's going beyond Ghana. This man is not just thinking about Ghana and its economy and whatever. He's actually thinking about the African continent and how we are supposed to link up with the rest of Africa. Mepacho react to that, Mami.
Yeah. So, and America say, or no, because of the name dear. Just what the Coco share United Nations in the day, a bra woko WTO, ne connections with almost all the 54 African heads of states in Intino. Just say, or no war connections on honum. I would name Hawa, Obitima ye, Ama Africa, Yegina Yatiasie, Abamuse look, see a casse ye corny say, Ebia. Moma ye nisika bako, moma ye say ye kaye humbum as a United Africa, whatever they will call in the Kaika. I can tell you that this man can do. Okay, yede ye can say Africa Trade Commission. A share in Sase 1 year now 1 share coin of first or Africa boom. Within the matter of 1.5 years. Now Watima can the whole Africa boom, 54 states no. I'm into trade agreement ya 2 days after. I just say country be able to my sport ne goods and ya call any Africa country without restriction. Any other day. The walker no would be a walker. Na say Ghana for 80 ama and kaya man the opportunity. I can tell you. Say when you lay foundation to say na say move no. So on that because we share the great nations, we share the US ne nkura akeka ho nyina obi de di na si ho no share bibia se ye ma metwe Africa for nko as slaves no mo nko bedu o mo country si mo mo gra no e obi ene edwene ho a wo de yes a ene emfaso no wo ho no Trump ne o mo current president o mo titititi other countries ni nyina no or more benefited from that. So, was say that time, 1957, na Kwame Nkrumah sasem way dia. And yeah, as I say, for the serious. Say, and there baby a yedruno, as I say, a call beyond that impo. So on that, because Kwame Nkrumah saw it. That was yes, Ghana, yanya independent. But say amwa at all other African countries, anya independent, ni anka ye one mum, say one continent, yanya one president, yanya say ya. I tell you, say, yenko baby ya. No, and I make kind guy speech, is it Lord Macaulay to the British Parliament? That was around 1835. Ebra Oba Africa. Ya okwaya no my report. I know say what travel across the country of Africa. That I don't know more Africa see in a bako. What say one who ohia bako kra. What say what share the word Africa ye wanna it will be difficult. What say what share your education a solid. That amo 1835. What say what share your region superb any other. Ain't you know? Say omo betima defeat Africa dia. And they just say omo echi adwene. Na omo starting ma Africa for who say bibi free Africa bia no enye papa. Ano omo ye ya no omo starting say omo ya petish ya ye no omo de asichire kakra kofra na omo aye national.
Radio culture.
Eba ye ehimfo no no a de aye passionate. Those days omo no ma pio ne insafufu. Afede na bibia snap ogos de asichire kakra kwakogum. Interpretation in your view, a snap on the song net. What mommy who say, oh, ene. Just say, Otto and Pabua, ya or Ghana, a shady partner show, Nancy was here, Kumas and Pabua the show. Now, or pay Italian shoe. Now, the rep, he say, Otto Italian shoe, no, na Ghana, air sofa, na Italy, air costro, any other day. But what would the money na? Look, they discuss almost say, yeah, region, and you good. I know more yes, okay, yeah, introduce Christianity. When we introduce Christianity, I don't say that time, yeah, religion, na no more at the Sumyamia, na chrono, any hono. When we book, I know more painting to. Yes, we dear, your friend of Bonsam, we, and the young coupon, we, or your bosom, we, the Jesus Christo, any other day. When we yes, I don't mean nobody che agony. So, Netiano, Emrofo at the honum, Sabio. Bema to me catch any uncle Bema say or person worry no. As soon as say Africa, say who worry me no enye. Who worry me no enye. So net you know. Just say what mutimi e brainwash ya ache ya dwene. Ama say pa say nkansem papa ya alanchemate kan nka say Ghana for etimi man the opportunity no. When say what you see oh na say we cry there. That omo akwakotie obi a woye chiwempo obekwa read books no abegina ho no aka ne re no okọ odi two mission sanso a fon ontimi nya hwe ene ade eno ada
speaking of so we are a very international person. Michelle some time ago in New York me interview our UN
okay.
Assembly
International Youth Network, okay.
Yes, back in the day. But yeah, you now are the director of field operations for UNU Party. Maybe so, who were any intentions of forming abroad or overseas cells, Anna? Because you know very well, say, a group like NPP USA was very instrumental in the election of Nana Addo Dankwa Akufo-Addo. More our plans be to form overseas cells for the United Party.
A part of your constitution. Yeah, a constitution. Yeah, a BBA. So external branches will be coming. Eti omo mutie omo USA. Though you some movement for change, your members will honum any other there. Transition to UP. Yeah, as many as possible. Omo person mujani bia no mujani. Yeah, me say ebia program be on New York this weekend. Me say. Ebia metimi ababia. Meba may take the opportunity to do a lot of media tour just to start the US branch. Yes. You better make sure say BBA as many as possible no. You better many branches or honoma. Almost better many juma. Ede aboa eye.
And as I say, I be a baby no me Ghana. But he say, oh, Oral and Chamatia form a party. Yes. But yet then I'm about to join it.
Oh, Sabredi, your head office, Jolo. Vortic, water for the normal factory be almost started Jolo Honum. Into Drew Jolo Naka say open Vortica or Mubetro area Honum. Udru Honuma, your headquarters, Honum. Now all the regions in Susono. Before Siababa Apono, your war, our interim regional officers, our more Honum. Until very soon. I'm say acha by next midweek next I just about Wednesday na ye movie a free Accra ye call around the regions ye call establish it. In fact, we are not coming to be that party yet here no mutiwa ebeka 2 months elections and no, we are not going to do that. We'll make sure we are going to establish all our branches. Every polling station, we are going to get our officers there. Now, strategy in to put us ahead. Because MPP, our 5 polling station executives, NDC 409, we are aiming between 12 and 15 at the polling station. Eti ya establishes money in every na shebe we are polling station for one crackers or more to amaya. Say 15 times 40,000 polling station. It should just give you a clue how we are going to go. Eti a idea ye put to in place ye near pray. It will be bia o pesa o journey biano. Oh dear, very soon. Your website is almost done. Almost done. Honestly, no, you better publish your mama for. You can just go there.
Would be recruiting if you are now. Some person join me. Make me once the website is done. Make me alcohol register.
Aqua register. And then one is what select baby awo. ABS or a brochure USA no aye to direct you to a contact person. So on that you know. Na yeah. And it's our Accra. What you so Greater Accra. Na fe constituency awo. It you select a constituency to pay once a director to contact person any other. Yeah, prepare Sade no ebe shase na enche obonse na fe ye issue membership cards and so. Your membership card no so be the modern membership card no ebe for multi-purpose. Be making sure say cheap ubetima deposit iska or so or de be church dues ni e kai kan. Nti a whole lot of ana ma afe na obi be se ya shase shebe endi be se 1 month no na samwe ma we nyina edida na kwan mu a obia baby obefa bia no obetimi a register amana yeye.
Nice. Na afen so no say more plan before parliamentary where I mean say obviously the bigger picture is to win the executive to control everything. But as a strategy, building up to that, more plan be say bet me up for our constituencies way you low hanging fruit be or you bet me up place candidate or grab a parliamentary seat for a start.
All the 276 constituencies in hanging fruit. We are going to contest all.
Okay.
We are going to contest all. Yenja one constituency problem. Yeah, full political party. Once we want to rule this country, we should also get majority in parliament. So on that, 2028, not a single constituency. I have a way there. Yeah, any person won't contest. No. You better make sure say you're contesting in and I can assure you say January 2029 almost in the 10th parliament, now UP members of parliament and so already I can assure you for that.
Interesting. Now the obvious elephant in the room, no pun intended, but a lot of pun still intended. But you see,
in 5 minutes time, no, Mr. Wana,
it's a very important question.
Yeah.
Obvious elephant in the room. But this is a question where I share with before Kakra. But let's rephrase the question and address it. The formation of this party would definitely affect the fortunes of the NPP. Ebimo Akase, part of the idea was to get back at the NPP. Oshe Oral and Chamatia, he has a reason to be upset with the NPP. Oshe Obi to say, war. You have a reason to be upset with the NPP. Oral Bobia Samoa. Entino, how do you react to that? Say the formation of this party was partly, if not in whole, to get back at the NPP. And what do you think? Said the
Obia Sebia no na Sebio onye politically sound. Now they say Ogrom has no mama amnesty anamwa. Nanka ejen wani say DM regasi yeko.
Musasa mo troll tamran sana.
Ana me chete. Se pesi e troll kra, say give it to matro. Anamwa.
Yeah.
Me makano number of times he say MPP oye me den. Enya dia me go back to MPP. That one people should get it right. So netiano. Alancha mantin oye den onko MPP da. Yewie eno anami akwakọ form party no. Say about wiki obi a person winning elections there. Say obi wiki parties ni na now they are winning. Anami wa.
That's right.
Won't mean weekend party back up now they are winning. I say weekend parties in an to me at the winning. Now, yeah, well, MPP mu, free MPP mu, and the above for more say. No, because and a UP no, a MPP route, a MPP route. Now, yeah, every never. A MPP will everybody. It is our route. We want people to know, say, Savalu suna na ewomua ubu. Ewomu ni ekari ka hono sabu no ayira eti yen ane yedeba eti enye yes we want members from them some members ni na ba bedwane a we say hallelujah you want members from everywhere omo any politics yeah there are some people another meeting lawyer bi what's one on any party, particular party biada. So, but you know or monitor a crab no ahade. Say ohunye opesu ohuna obedwene no agye membership card. I was so sad. But I can't say so happy to hear that. Say or kase or don't be any party that but we know or who said you maybe go ya obedwene as a party. So on that and target say ABC and as say, look, Obia wonam wiase bia no ewo ambition. Wo aim ni say, o pese wo yesi, o pese wo yesi. Wo ye adwuma towards it, you will get it. So on that no. Eti Obia wono one nature alanchamanti nature presidential ambition back in 1996. 1996, na Young Executive Forum. Emrantie ne mabawa na chese omuye business people omunse musika ana omuye say look adubu ahiko ya anyeye no ese say ye supporto alanche mantene de nkokodi president that time appear minka in his book River in the Sea okan page 256 was stated all clear was it say alan koya go BTJ ekufo ko we ne ye ko be ye frabera for the party. Na esise impenifo che alande no kwahye dem anom ne kasa ya se je ekufo aye ni nua peni on de o makwan no wonko ne eba bedru ni so eni ade tama ala conceive that na Akufo adon conceive with obedi president conceive with obedi president enti no woye obi a wono na ye ani se Ghana ebeyeye na Ghana esi na ni so on the no do you say sa vision now work for the country wo tatis bibe bogua and then there are so many ways of killing a cat it will be who knows and maybe an America be say nyankopon nim ne enti a wa ma Akufo Addo win in 2008 our den about 2016 nyankopon nim ne enti a o ma Jo Muhammadi one time president a o ma ne tena opposition for 8 years afi no ordinaba nyankopon nim ne enti a eti nyankopon nim ne enti omo eye ni omudi edi alan no nyankopon nim ne enti omo omudi edi no nyankopon so nim ne enti a wa ma alan afomu party no so on yet no etamu come politics is becoming so sophisticated eti omo muti wana enya effective na do munya motrebo ko no mo hwade omo be hu ne ebeko first na ka traditional media eye so powerful Obi kasa that time gra obey dem gra no akọ radio so akọ kasa. Now it was there for a few privileged people.
Yeah.
What do you say?
Yeah.
Wonye minister da wonye ya o ye da akọ tra radio so. So but ene akwala kete TV eno ane se wa fa the phone obe kasa kire wiase afa na nyina. Ene ne kai ka. The world is changing and a time will come. You trunya kase no UP ni epa obi eni ho betima sesa o madwene. Eno ane se o de UP baba.
Ora hopes na there was CPN himself so called executive meeting for the party me patropi ya besa Asia bio na me pese Asia fa great transformational plan no na yetutum na yetuni sani abasa na yekomu ye pa na cheche mu kire ya hwefo na yetiefo nyina se say de mayenya ya be yenda was CP for
but that's it aya no obetima se ne me o number o chat mu na
me patropa
e base metima ba New York na no mafro na yetima nya time for
they are classic. Okay, between one on week and Kenya background. I would easily fly over to New York to meet with you. No question
that's
about
right.
it. Yo. Now, last thing, Nipa Pamo political suits no. I am a maintaining car. Wamana fatal do.
What does it? Oh, Kumase Amekum.
Oh, I see.
Wapam me come and only say Tiagakra.
Because the Mihusa Yetia, Mihusa was shed the prices you style pa a fatal yellow political is now shed the call launch no.
Yeah.
Bad cry.
That's it.
Yo, yeah, that's CP.
All right. Yo, bye.
Radio culture.
Okay.
Radio culture.
Okay, Mr. Hobson Adoye, a director for field operations for the newly formed United Party. Now I was all continuing and common here. Like I said, another time your best friend need come more about the great transformational plan, which is the bedrock of the formation of the party, the United Party. Thank you very much, Mr. Hobson Adoye. Short commercial break view. We will bring you our report and we'll also bring you arts and culture.
Since 1994, crafting natural products with organic shea butter and red palm oil. All products are available on Walmart.com and Shopify, or visit our website at chrismark.com.
Yo, Russ.
Yeah, my brother.
It's time to go back home.
Same.
It's time to go back home.
Yes, see? With all the stinks, that happiness. Zion train is coming, jumping.
It's been a long time.
See.
This is you know. Have to go home. Huh? It's time to go. It's time.
Oh. My people are balling. Come on, yeah. Why, yeah. Zion train is coming. Jumping on the train, yeah. Zion train is coming. Oh, yeah. Zion train is coming. Jumping on the train, yeah. Zion train is coming. Watch out. In the gully when me live, me see me people, them a ball, Mr. Big Man, Lord, them not care. It's a pity when me see the ghetto youth, them a cry, Mr. Big Man, Lord, them not care. Yeah. They use them balling. Why yo? Yes, it's time. I got to move. Yes, my people crying. Oh Lord. Yes, in Malata. Oh yeah. Oh Lord. In Nima, Shukura, Mamobi. Why yo? Yeah. Take a look, my people in yeah. Oh yeah, oh yeah. Zion train is coming. Jumping on the train, yeah. Zion train is coming. Oh, 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 yeah. Zion train is coming. Jumping on the train, yeah. Zion train is coming. Watch out, when people are balling. Pure separation upon the country. Mr. Big Man, Lord, them not care. Why I check out the ghetto? Why my people are balling? Poor people them striving. Take a look around the ghetto. My people are crying in Shita. Take a look around the ghetto. My people are striving in Munshi. But Zion train is coming. Jumping on the train, yeah. Zion train is coming. Oh, 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 yeah. Zion train is coming. Jumping on the train, yeah. Cause Zion train is coming. Oh, 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 yes, it's time. My people want to go. Yes, to where they belong, yeah. Yes, in Addis Ababa. Down in Ethiopia. I and I want to go. Oh, 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 we want to go, yo. Zion train is coming. Jumping on the train, yeah. Zion train is coming. Oh, 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 yeah. Zion train is coming. Jumping on the train, yeah. Zion train is coming. Oh, 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 yeah. Nigeria, jumping on the train. Ghana, jumping on the train. Zimbabwe, jumping on the train. Liberia, jumping on the train. Sierra Leone, jumping on the train. Guinea, jumping on the train. Gambia, jumping on the train. The whole of Africa, jumping on the train. Zion train is coming. Jumping on the train, yeah. Zion train is coming. Oh, 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 yeah. Zion train is coming. Jumping on the train, yeah. Zion train is coming. Watch out. Yes, it's time. My people want to go. Yes, to where they belong, yeah. Down in Ethiopia. Yes, in Addis Ababa. I and I want to go. Oh, 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 we want to go, yeah. Cause Zion train is coming. Jumping on the train, yeah. Zion train is coming. Oh, 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 yeah. Zion train is coming.
These two men be sent to the jungle for 40 days and 40 nights until they repent of their sins.
My lord, my name is Headmaster John Oriakpo Ezahakpo Odakpo. I set the exam. This lawyer's son failed the exam. The next thing I saw was his father suing me to court because he's a lawyer. My lord, is it my fault that his son does not know book? This case is a stupid case, my lord. Is he the first person to fail the exam?
My lord, before I proceed, may I introduce my humble self? My name is Evarestus Abagana, exporter, October, November, December, supplier, replier, importer, sequoia, require, esquire, barrister of lawyer. My lord, my client, young Mr. Ajala, Ajala, is here to dispute the result of his primary one exam. Dear my lord, Teacher Dakbu ask my client here to name the animal that is the king of the jungle. My client said that nobody is the king of the jungle, and for this, Teacher Dakbu failed him.
My lord, is lion not the king of the jungle? Who does not know that lion is the king of the jungle? This is a simple question. He failed.
Onyankuzi Dakbu, do you live in the jungle?
What it be this? No.
Have you ever lived in the jungle before?
No.
Does any of your uncles, cousins, or aunties live in the jungle?
No.
Onyankuzi Dakbu, have you been an animal before? Maybe you were an animal as a child, and now you are a human being. So you know something that we human beings don't know. Answer me, were you an animal before?
No.
So which animal exactly told you that lion is their king in the jungle?
No animal told me.
Hey, So when was the lion crowned the king of the jungle? Who crowned it a king? What year was it crowned a king? Did you attend his coronation ceremony? Or did anybody you know attend the lion's coronation ceremony in the jungle? So that we can go and ask the person some questions.
No.
So, if you do not live in the jungle, your family members don't live inside the jungle, and you are not an animal, and animals did not give you this information, who then told you that lion is the king of the jungle?
Yeah. That is what people used to say now. That is what they wrote in the book now. The book we are using to teach the children.
Mr. Dagbo, which of the wild animals wrote that book?
How can an animal write a book? It's not an animal. It's not an animal that wrote the book now. It's a human being. It was written by Mr. Chichankponoma.
My lord, may I call Mr. Chichankponoma to the witness box? Dear Mr. Chicha, are animals even aware that lion is their king in your book? Did you inform animals, or did animals send delegate to the meeting where you and your publishers decided that lion is their king?
Your account is
no. The animals are not aware.
Is lion even aware that you people made it a king of animals? Did you tell the lion when you finish this meeting, this publishing, or when you finish writing this book? Did you inform the lion? You say, bro, now you are the king of animals, so take care of them. Did you tell the lion anything?
America will know.
No, we did not tell the lion.
My lord, I demand that these two men be sent to the jungle for 40 days and 40 nights until they repent of their sins.
By the power invested in me, I hereby sentence the teacher and the man that wrote the book to 40 days and 40 nights in the jungle.
Welcome to Tucson Hotel, your ultimate home away from home. Located in the serene town of Ejisu Ichakrum, just off the Jabin Road, we offer you a haven of comfort and luxury. Step into our fully air-conditioned 40 bedrooms, where modern elegance meets convenience. Whether you choose our normal, standard, deluxe standard, or executive rooms, each one is equipped with Wi-Fi and DSTV, ensuring that you stay connected and entertained throughout your stay. Indulge your taste buds at our exquisite bar and restaurant, where our skilled chefs prepare a wide range of culinary delight to satisfy every palate. From local delicacies to international favorites, we have something for everyone. Planning a business meeting or a special event? Look no further than our state-of-the-art conference hall. With a capacity to accommodate 80 to 100 people. It is the perfect venue for your corporate gatherings or social celebrations. But that's not all. We proudly boast the largest recreational center in the Ejisu municipality. With a capacity to accommodate up to 2,000 people, it is the ideal location for concerts, weddings, and other grand events. It comes with 4 fully air-conditioned bedrooms and a kitchen as one package. Our luxury cars are also available for rent. Drive like a boss. To experience true hospitality and unmatched comfort, contact us today. Our friendly staff is ready to assist you. You can reach us at 0244 654 458, 0246 505 327, or 0241 418645. You can also email us at info@tucsonhotel@gmail.com. Tucson Hotel, your home away from home.
All right, and we are back. We have arts and culture for you, and the arts and culture is going to be very exceptional. I can't wait for it at all. But let us get the reports out of the way quickly. Justice, if you're ready, please come in the green room and let's get the report out of the way very quickly. And Synergy, my apologies. I know we're supposed to do arts and culture. I mean, it's arts and culture, and they're very lengthy, so I'm trying to get the report out of the way very quickly so we can take time and do justice to arts and culture, please. Thank you very much for understanding. In the meantime, Justice, please come in the green room so we can do justice to this. In the meantime, we'll be right back after this.
Blood of the slain will never be in vain. Never. No. We don't want to see no more people dying. Zion Yahweh. Whoa. Zion Yahweh. Whoa. Zion Yahweh. Whoa. Zion Yahweh. Yo, listen, man. My name is Ja, beloved. You can call me Kwesi back when the occasion calls for it. You are watching iCulture TV. Keep it locked. iCulture TV. Africa. From African perspective.
Making healthy food choices are a daily challenge for most people. You see, the food you eat can either be the safest and most powerful form of medicine or the slowest form of poison. Introducing the Green Health Pharmacy and Functional Medicine Clinic that gets to the root cause of your disease. We present to you the True Green Foods brand that allows you to enjoy healthy food options without sacrificing the foods you love. True Green Foods have low-carb swallow options for fufu, banku, tuozafi, eba, kenke, amala, and semovita. Good tasting and supremely delicious without compromising blood sugar, blood pressure, cholesterol, weight management goals, and all diseases that one may be battling with. They also have a low-carb replacement for oatmeal, grits, and cream of wheat, which are highly dense in carbohydrates. Check out Alta Oats, Beta Oats, Clean Oats, as well as Kajma Porridge and Cream of Lacca when you visit our shop. The breakfast options are not just delicious, but meet the standards of an anti-inflammatory diet. All True Green Foods are all diabetic friendly. Find Green Health Pharmacy in Woodbridge, Virginia, or call us on 703-670-3640. WhatsApp 571-300-5039. Find us on IG at Green Health Farm. There's no better way for a healthy lifestyle. Remember, your health is your wealth.
Okay, we're still waiting for Justice to come and do the report. We don't have him and we don't have much time to waste. Let's go straight and check in with Synergy for Arts and Culture. Synergy, if you're ready, please activate your camera so we can go with Arts and Culture. Being as we still don't have Justice yet for the report. Okay, there he is. Justice is here now. Let's go. Synergy, Justice has shut down on the Woody hide and seek. But he's here now. He has two stories. Let's get them out of the way really quick, and then we will come to Arts and Culture. Thank you very much. Okie dokie. Reports from across Ghana. Justice, fire call.
The movie be aquaba. iCulture TV, Radio Culture, GH News Now. Justice Mafo. Ebrason Semede. A report or a different sentiment temu. Yede breya hefo ne yetiefo na yetufa ne yede ani akire eye Jacobu Amansie South ewo Jacobu na ehona NDC amanyukuo no emabunu bi ese eba impuntuduma wo krom honom a abo omo yie paaru nti no mo sre His Excellency John Dramani Mahama, the regional minister any member of parliament owo ho se omo sre no a omra no mo meye wo moa eba social amenities a abo wo mpa titiriwe no wo nkwan akwan a wo ho no mo nye bridge bi wo ho no mo eno soso a enkoyie eno nti no ama enkrofo nso so afa bronya ho ewe nkokọ isan se pragiafo no mo wo ho ne mo use tricycles no omo fair anka 5 cedis no omo increase no e de 50 cedis e de bi 30 cedis eno nti no kalkum ye jere kwakuonum Wabra na NDC emabunu no bi kasa no sei ɛna ɔmo de tu dwa sɛ newsroom ayɛ krado a ɔmbɔ yɛn first interview no ɛmfa ɛma yɛn wɔ bra na NDC party executives no na ɔmo de ɔmo sɛ
ɛyɛ ni blesam na ni blesam ne sɛ na no sɛ yɛte yɛkurom yɛni ya no sɛ obi aba sɛ asase no aban bi ama no so ɔmo na yɛ project wɔ hɔ sɛ project a ɔba ma yɛ ni project kro ɔmo de datu nana.
Is this the right video?
Where your second interview? No, where your second interview? Yeah.
Sorry about that. Let's get the right interview in. Please hold on 1 second. Let's get this. I believe is the right.
Sema omuni say. Sa kwan yen say we nyina kwan a ofa so a enye. Ya na aya we ho kese ni say. Ofa afakon baja kobu a. Ye wo bridge ketwa bi ho. Ya nsu bi da fa na atmanka. Ensu so na bridge na bu. Efi na be na wotwe eko na wotwe mienu ni. O pese ofiri kuma se eba. O be du bridge na chi a. Ni se usi no so wo niam na aba. So fa bridge ne so nso a. Di se adofo bi eboa wo. No one need na ka na twa. No ma do 20 Ghana cedis. Ansa na Ghana what me dey. Sa bridge a make you hear about 5 to 6 covers per year which me dey say ama e kwana dey atom. This be no waba Amase Central. Yeah, what is chain? Sir, this year by an amenity. Even public account committee. Or see your teenage IDF internal generation fund no 15 billion Ghana all series. You know this career. Yes, I did the 8 million a day. And yeah. Abayim Rem. Regional Minister Rem. Road Minister Rem. Say paye ena this you know on engineers dia omon kan say o yentimi hwe e ma say okọ baby is o si ansa no sa be fo car akọ baby a o pese dey okọ
interesting.
Ye koye ni mu ana ye gina amanse ye ho na kuro foforo ye frɛ no Manso Nyankomase. Manso Nyankomase honso so emabunu ni bi nso so ate atua se omo de petition ekwa akoma district assembly wo ho na afi omo de bi nso so akwa akoma regional minister isan se yasisika ni bi abesi ebe ye project bi wo ho no mo a ama project no nya de omo bepene ama akoso omo wa hyase a obubu nkrofo adan eye market wo ho nso so yesi omo relocate emfa nko ba bi foforo a omo nti ase na nipa no nso so kire mu a waje permit afiri aban ho no mu aban na ama no krata no se onfa meye sa project na no nso so oma tentesu kokko e de a kire sa nipa no ne aban ne se sa aban no ya ade a ne nsa hyase de a onya e ya ade a wo se otwe e de sensan na nipa unit committee chairman e wo Manso Nyankomase wode nsam tudwa wo bra no ne nsentwerefo e di nkomo yentie bi
ɛyɛ ni blesam na ni blesam ne sɛ na no sɛ yɛte yɛkurom yɛni ya no sɛ obi aba sɛ asase no aban bi ama no so ɔnam yɛ ni project wɔ hɔ sɛ project a ɔba ma yɛ ni project kro ɔmo de datu nana ɛni ne fɔni fɔni eti nana si wɔn sɛ yɛwo yɛ deɛ ɔmo contractor no ɔbɛyɛ sɛ adwuma no ɛmra na yɛ nyina yɛ nhyia ne deɛ ɔwɔ bi a no yɛn kɛne ntiase yɛ adwuma mo yɛ mo adwuma ama deɛ yɛ adwene sɛ wɔ baba yɛni ya no sɛ mo de club yɛ sɛ wuri yɛ ni nhyia yɛ bia na ade a aban yɛ de ama no sɛ wɔn yɛ sɛ adwuma no wɔ ha do deɛ ɛno na ɔba bɛyɛ ɛdeɛ nam so na yɛyi dwuma nso sɔre gyina ɛkyerɛ sɛ saa na ɛkɔ deɛ a anyɛ na mo sisi yɛ aban yi sisi yɛ bisi yi sisi yɛ sɛ asɛm sɛ yɛba na bisi ni amehyia aban panyin bi ama yɛ hɔ na wɔn de mfidie abɛbɔ sɛ wɔn bɛgye yɛn nsa ase ayɛ wɔn project bi a yɛmpɛ ɛdeɛ na mo sɛ ɛti ɛnan no tu ada yi ɛdua yɛ etwa ho wɔn de asogyafoɔ abɛwu yɛ kura ni mu abɛtutu otu okuma abɛ pɛbi pama emu ama sɛ sɛ wɔn gba yaresabea abɛyɛ no wɔn man no na ɛwɔ wɔn ka ɛdeɛ nneɛma wɔn a yɛkɔ so a mmienu sɛ disiri ewo sɛ disiri unity a wɔn ayɛ wuli baabi kɔ ɔmo fie ayɛ wɔn bɛyɛ adwuma
adwuma no ayɛ akɔfa saa suntibia wei ɛde ama yɛ na sogyafoɔ ɛtoto yɛn kura tie no wɔn da mɛkyerɛ yɛn yɛsoma yɛ bi ɛbɛto bi si yɛn kɛse a wɔn de do tie n'akyi no sɛ wo kɔ so na yɛ wu sɛ wufu saa nyankoma se akyi wa ne yabo ɛne yɛ ne wɔ kasa yi enipa no mu wɔn abu wɔn mo wɔte nyinaa paapae ayɛ yɛ wu wɔn kura bi ayɛ wɔn mo ba yɛn twi tuo yɛn twi sikai ɛso bura na wɔn mo yɛ na wɔn bɛ di mɛgya pa.
Na amanebɔ no kyerɛ mu a yɛsɛ asogyafoɔ akɔgu kurom hɔ nom a deɛ mabunu no yɛ no nti no ɔma hyɛ ase atwe domire de asi wɔ mo so nti wɔ mo nso so ama asraafoɔ no 3 days ultimatum sɛ ɔmo mfa nse sɛ ɔmo nkuku no ɔmo nkaka ɛmfa mfiri kurom hɔ nom a ayɛ asɛnkɛseɛ paa ɛwɔ manso nyankoma ase nti no yɛ GH news na yɛn nso yɛdi ani ɛdi akyire nyame boa next week ɔmo nso ɔmbɛsa yɛ press conference wei no mema obi na de Sunday me ya ankasa yɛbɛkɔ hɔnom na yɛakɔ akɔkutie deɛ ɛkɔ so hɔnom na ankasa nti no yɛma yɛtiefoɔ ne yɛahwɛfoɔ aso nsi wɔ ho
Justice yɛbɛda wase pii ɛne adwuma a woyɛ no da biara na sɛ na wasi ahyɛ yɛbɔ no fa w'ani di saa asɛm wɔ akyi ma yɛ paa yɛpakyɛw pii na na wohwɛ sɛnɛ na wabrɛ yɛ update on this one.
Okay.
It does be.
Radio, online.
Okay, live on Radio Culture, live on iCulture TV. To say you go straight to arts and culture. And say nyabo arts and culture, na munim nipakra yebehu nenim. Not so long ago, married young man. Synergy is here with us for arts and culture. Synergy, no matter saying. How are you finding married life?
It's quite okay.
Wow.
Very beautiful at the time and sometimes very stressful, but such is life. So you just have to comparatively combine the two and know how you can choose the right thing at the right time.
You get the key already. Arts and culture. And then
okay, right here on arts and culture, as the name goes, synergy, always the two fingers in the air. It's all about this marriage thing now. What you can be having one seminar. And whether I say marriage is sweet and I say a bad, and the whole thing has to be the ultimo and no come and at the end of it to be who they will be at the amount. Now, this in common is about our legend, that number, someone will leave a legacy in our music space. It is very important and I say difficult so but myself. But I say, and you will not cry and you or you're very secretive or you're very quiet person or you will be a hard is over who needs to grow up on team by a name, no one some that one team baby. And the reason is who becomes Kuna. We have the first wife and the alleged second wife or Odobronia. This year, and as you say, legally, that Odobronia, a married woman, I bet in associating with that number warren and answer or not. That is going to be our point of direction. But people are asking, say, Ebani saying, and Akusia say, well, yet that Lumba first wife or warren in 1993 in Ghana. But did the ordinance marriage in Germany in the year 2004. Now what's now one more? Not that number a win 2025. Now fade Obi claim say, oh yeah, legal wife. Engineer man of man in Yukuna. At the same time, Nipa or non so no you who say after so Kushia say wow. A free in China or Quatina Germany, I want back to Ghana, Madame Lumbatana, yet TBI or Dobruni. Obetibia or Dobroni, and Kofo Case or Dobrenia Brepa. And it's a whoop will be a man of common you kunana. I was thanking you, Dobroni, Nembum, and Yakusia Sewa. But the whole thing is Ghana and any country, we have laws. Anyhow, things have to be done. As we say at the corner, a Mrakwanso, near the far. So the chrono so just normality, a moral thing. So it is also has its own way, traditionally, culturally. And also you can't want but we a marriage issue where what and non so many laws are binding this whole thing. So with that we have the lawyer for Akusia Sewa. The reason why here Akusia Sewa is entitled to be the legal wife Emma Daddy Lumba, the late legend. And you heard that video, the lawyer explaining the details about the marriage that happened between Daddy Lumba and Akucha Sewa.
Has to do with what you said after Moko court,
I have the sister of Lumba here.
A different, hold on.
And she represents.
Yeah, the first.
The other video, Nana.
Yeah, the other one.
All right. One moment.
Yeah.
Okay, so that would be.
Quickly, we want you to also give us information about Moko Court, so far, saying the issue.
That would be the other one. This one is about
does it still hold on
the other one. The last one I sent.
Of course, it is pending. We are yet to move it. But the Mremuno say filing motion as a movie, the motion is as good as having been granted.
It's the other video, the last video. Yeah, the last video, yeah.
Moko Court,
I have the sister of Lumba here.
Oh, I think we have just two.
And she represented Akosua Sewa in court today. And this demonstrates the kind of love the family has for Akosua Sewa. You get the point. So those out there who are making noise and making statements, they need to understand how all these things played out. And they should know that Akosua Sewa is the victim, not Odobroni. This is what we want to impress upon the country. It's Akosua Sewa who is the victim, having suffered desertion for 15 years, with 3 kids, managing them in an icy land. You think that is easy? So people should appreciate her concerns.
You may answer. Akosua Sewa a victim because only couldn't two kwa bruchri. Omo bobra bruchra na be man send the chi and ya. Or they go to Germany and say, oh, my operation was on new abrofo doctors in new. Among African star, number one upon Yakun. And to a professor of Bagana, no by operation. I could just say one in the Bagana. Omo to you or Nijani sister, and no coy. And a Berman or we operation, Murabra was a member, Murabra was watching, Murabra. Or bar German Bagano, San returning. Namra wo free Germany na Akosua Sewa ba last one no otuano fuano.
Okay.
That's how young the child was. And Oba Ghana.
Okay.
Everyone sune. Mama no enya numba amana wo mo ne bed bium. Enkola no so mama ne na ehwe omo. Na de ya wo ma na mama da so to Germany brand say was it a facility view of over 100,000 euros. Yeah, I Lumba Hombra and Jins Absicano. And then on a year Jumatuaka and into Dimima because Oba a kind of Ebekasier.
Okay.
And if I say that she's a victim, if you hear the story, she is.
Okay.
Unlike Odobroni or Noba and Lumba, either the Lumba. That's the dance if he. A story building, a TV station, and all those things are in a bush of phone at a Google, no more managing. He has been a beneficiary to the profits of Lumba, which profit was created by Akosua Sewa.
Okay.
And I don't see a tear.
We want you to also give us information about Moko Court, so far, saying the issue now, in Janshin Bay, does it still hold on a year now?
Of course, it is pending.
So quickly, Synergy, this is the right. Oh, I'm sorry, Synergy went off. Well, I don't know what happened, Synergy. Sorry about that. This is the right video, right?
No, this one is about
to move it. But the say filing motion as a movie,
but no problem. You can hold on that now. If you are not you're playing.
And I'll make a video now. You're bothered. I know what you are near.
Yeah, make no matter. Then after that, you know, and quickly to the video now. Here, Baba Bono play the explanation now. lawyer no edema no. The most important part of it, you know, is we all want to understand the reason why Akusia Sewa by law one no any the legal wife of that Lumba. Na emono enye odobroni. According to the law, if you marry someone under the customary right and now say the customary one now, you are only entitled to ebusuanen kwa. If something goes wrong, that's often itself say ujaya warrior. You go to the family, what the ones are come where they are warrior. No one has any problem with you. But the moment Obabeye the ordinance no, the ordinance no na ebe lead you to court. Obo since every certificate be a band they will say my warrior no, now it has been bounded by a certain law which needs a certain protection by law. Nti ni sɛ anything bi asi na wopɛ sɛ otwitwa mu a ɛwɔ sɛ wɔsa akɔ the same court hɔ na wakɔ akɔtwa mu. With this no ɛno ɛna dade no badi kan ɛyɛ no wɔ Ghana 1993 with Akosua Sewa. Ɔmo move kɔɔ Germany in 2004 ɛna wɔde customary one ɛde too hɔ ɛna ɔkɔyɛ the ordinance one no. Na the ordinance one no the right obia ɔbɛyɛ the ordinance marriage ɛwɔ biara no that person is entitled to one husband, one wife. If you do the ordinance marriage, you are entitled to one husband, one wife. In this, said that Lumba Ewari Akusia Sewa under the ordinance marriage, it means that Lumba has no right. So Obewari Bim, no matter what. So Okowari Ubimpo, na Obo Viasi Kenyina, or the nature Viasi Nina. Nasa Wankwan could try the first one, na your ordinance, no, any papa for a year anymore. Say next, so that Lumba that form, and now will be the form one. That person you're wearing under ordinance, and that person or what the legal right to be a widow. And you know, that is the explanation that the lawyer Edema, the reason why here Akosia Sewa what the legal right to be the only legal wife of that Lumba is because she was married under the ordinance marriage in Germany. That is it. In Akosia or Dobroni dear. It is not bound by any law. Say, I'm fine, say, Obi Bessie, Sikabi no Konya Roma when Yan free. Say, a Mabin Obenian woman, ne mark the benefit from that number because on Papa Newu. But the wife now, or Dobroni dear, by law, the law doesn't know her. That is it.
Interesting. Being a lawyer, means you're a lawyer. But, and no be actually Number one.
Okay, then ask.
I think there is a question of jurisdiction, which we are not addressing. Commentary, same way as Sema. This is the one time I mean, some more quarter. Everybody's feeling free to just talk about it and nobody's even worried. Okay. But what I'm saying is that I am noticing that nobody is considering the issue of jurisdiction. Jurisdiction in the sense that, Sisi Awoka say, or your ordinance marriage or Germany. Sisi so asema yeka kan Ghana. Okay. In Ghanaian, in the case of Ghana, so the Ghanaian law applies, not German law, as far as I'm concerned.
Okay.
Don't take me, Mamo from Asem Kokoto, because me was a lawyer. But as I make an say, in the court of common sense, you can't no Ghana. And to say, yeah, why you Obama dear Ghana has said, that's a Ghanaian law, acknowledge customary marriage. It is difficult to write off the customary wife, no, unless you take the issue to Germany. Then the laws in Germany will apply. But Ghana has said, but we are trying to say, oh, ordinance marriage, the good thing is that customary marriage and ordinance, no.
Yes.
That will not write her out of anything. What is that say? So whatever benefit the other wife now in the year or the customary marriage in Kwano, or not only customary, but we say they're a customary plus ordinance. And to me, first of all, lawyer,
which is Akusia say what they're customary plus ordinance.
Plus ordinance, yes. And I mean, to say Ubisa lawyer, no, someone in the interview said, I'm sorry, the Insanbi Koya or something like that. So the Insanbi Koya, it might mean something different because you consider customary law and also how is it functioning. Nasa Ode and sign qua. It means a Jaya warrior. That might
now
work against
can I come in here?
Yes, please.
Okay. For the betterment of education, this is how the whole thing is. You have a solid point when it comes to the questions that you are asking. Was enona ama bebre na are you confused by the right information and I said the right education enuni. So we are customary marriage, Now it's our ordinance. Automatically, the customary marriage, a writing it off.
I see.
Anything about customary marriage in Mubiana doesn't hold again. What cancel no? Into the customary the ordinance one no, and the mumbrani at the year juma. And two, so what the Saku a bushian horse or quack with the awari. Nebushani biaji and sana or power benum, war power debisiwo. But the bad thing is, and Sano doesn't call for divorce because the customary one near didn't Sakoko Jaya and automatically look at your ordinance, are writing it off. And if you want to call for a divorce, I was a court. No, I could try the ordinance one and none of the certificate I could sign. I wonder what the account was. Engineer non is a basana, a bushian will be, but court and we see a womb. Now that the jurisdiction thing that you were talking about, and the explanation is in this form. That Lumba is a German citizen, but a Ghanaian origin.
But that Lumba is also a Ghanaian citizen. Don't let's forget that.
Exactly. This is how the whole thing is.
And son of a German citizen. And I don't know how the whole a dual citizenship working in that. I don't know. But we cannot.
Exactly. Yes, a dual citizenship.
That he is first and foremost a Ghanaian citizen.
Yes.
Unless we are saying he, denounced his Ghanaian citizenship at some point. I say
no,
being a German citizenship nullifies his Ghanaian citizenship. And yes, then we can't say so it's German citizen. End of story. He is first and foremost a Ghanaian citizen.
No problem about that. But this is how the jurisdiction thing that you are talking about comes in over here. In law, if you have any problem, if you have anything, not a court, what you have to do is, if that thing is not within your jurisdiction, you go to court, and court will give you the necessary document, the right power, the right capability to say, even though there's a seminal with different jurisdiction, what the court the court will determine, say it is not within our jurisdiction, and you go this way or go that way. And the court in Mumuna ever refer to the right quarters. And once the court in Etia say they have the power, they have the said jurisdiction to sit on this case. But
the court in Germany may have the power to rule in favor of Akusia Sewa, right? Because she is an in Germany.
Yes.
But do their jurisdictional powers cover Odobroni Anna?
No. Odobroni Diana Edi Hunkomani say she doesn't have any legal thing binding it to become a wife of that Lumba because that Lumba has already been occupied under ordinance marriage with Odobroni Akusia Sewa.
A very serious matter, Paul. That Lumba probably created much more what's the word? Controversy than
controversy around yes.
Because it's not just about Lumba. It's about ordinance marriage versus traditional marriage. Say,
yes.
Traditional marriage, any ordinance marriage, and the court say. Because whatever is going to come out will set a precedent for the future. She say, Oko warrior, that's Ode and Sakuhu or Banebusia. What does that even mean going forward? Because she says, Berman bet me jail, or didn't in Sabe who were bushing, obet me since any obafu fracqua yet ordinance marriage, then no about the cancel, what would you know?
Yes,
a simple
and
answer.
That is because the customary marriage, and no, polygamous. The customary marriage is polygamous in nature. It means but the ordinance marriage, any moment monogamous. That means you are entitled to only one person, which is either Oba and Bema.
There you go. And I've heard one lawyer also posture and say, if Ghana, you're kind of saying, accepts traditional marriage, and then Ghana also knows, say, traditional marriage is polygamous, then it goes to reason that you can ideally have an ordinance wife and a traditional wife as well.
And that is possible.
And that's exactly the case in the Lopez issue. You can't easily write off either of the women, if you ask me. A case, I'm really interested in how it's going to end because.
But do you know the funny thing? Do you know the funny thing over here?
Yeah.
The family that is a Busiapeni, is trying to write off Akusia Sewa's right as a wife of that Lumba. He's trying to make the whole thing look say Akusia Sewa doesn't have any right to cry to become the Kuna. And non Akusia Sewa say there is nothing like divorce in his or in that Lumb's records actually with Jana Warrior. And she doesn't care. Said that Lumba Warrior for and that's one Warrior for. But she is going to court to fight for unknown right actually say Wawari that Lumba into Betima Yukuna. But so do
yes. Bema worry and mammy noa, that's a war. Isn't it possible for both women to do the Kunanaya Sumunye?
It's possible for them to do, but it was a penny controversy on the KT, and then I'm at this division, Abana, the confusion, Abana. Because there was a penny, I say, first of all, my accusation one you kuna. According to accusation West lawyer, actually, we say the threatened West started before the 1 week. Now she became quiet about it because of an say a mere threat. But 1 week, and they are still pushing. Say, man, come and in Yukuna. And no more at the injunction, a court. Say, if that is the case, the injunction call for 2 years. So, if you will not allow me to become the Kuna, then I will put injunction on the a year to say, court declare me say I can become the Kuna. I hope that the American arrest it's well established, clear.
It's well established. I'm just totally convinced, sir. Either of the two parties has a solid case. Before they were still made to. I don't know how the court is going to go on this, but I'm very interested in how it's going to end up. And it's definitely going to be precedent for future cases.
But do you know one funny thing? We call court with the same injunction, because court is right. And so we appear before court. That was on Wednesday. But when they went there, court told them, say, Ebusia penny, and so there are another case in their barber at all. They cannot sit on that case till say almost over Ebusia penny case in every. And they further asked the case coroner that honomono. Per Ebusia penny case in nature say, Akusia Sewa is not recognized in the family as Kuna. And the court should throw away Akusia Sewa case. And on our courts, our journey case need to 28th of this month. Say, Obedi can first of all, actually, was a penny in the case now. The buyer say, Akusia Sewa is not recognized as Kuna. Into court and to court in the end to the court at Naso. Naso Oguni say, I was a penny no as I'm not canny and no credit. On the case not to now Akusia Sewa, your permanent court. Na same boom, one much national pay and car tell you on the provided Biana said you're working. Say, whether the ordinance or the customary will be able to prove beyond reasonable doubt, you did yours under ordinance and you have the right to become Kuna there. That means a bushel penny, you have a bonica. You have a bushel penny for wasting court in a time. And send them by injunction. So, and I asked the lawyer, say, they say, you can't case in so, but time will call which is on 6th December 2025. You Ghana, it could be, say, case you be and send a year number. Engineer say a banisana injunction ye be ye free and now say a docoso ama injunction other swami a year. This is what the lawyer said with the injunction. If that video already the one we just played before we started the discussion
it's as good as having been granted.
Okay.
Anything contrary to the application because it's a court be determined. Okay. Motion and Kiko move. And I was a penny as well file motion say, yeah, client, I could say, wow. Only capacity to summon in the court to answer. The Bazo only capacity no much case in him.
Okay.
Or capacity the near bomb Mokania to us until no 28. Any first application be considered.
Na say lawyer meti wasam na si year ebusia penny ene yemfa ne say ebusia penny ne nkrofo edi kan ede another case as a court say maami akosia say wa any the capacity say ono no mum ebe akọ claim say ona the legal wife no nti yentina na na say o kire mu nso a say court tina so na wo hwehwem ne ohun ni say maami akosia wo that legal right na ye betimi ababusia penny ne ka.
Everybody can see a pa. Me and mention now, but take the
Wow. Wow. And son, as I'm no cry, I call Mumu.
Court follows the event. To the application, Bani Bogu, also a boka. Yeah. When the industry research, I answer the Yano. Also, Triaka.
Oh, okay. And you know, as it stands now, the date now you share on the 6th of December 2025, you know, till say court ebe declare bibia edin the judgment be ba bontin say montoa so no. Say date ni kura so a funeral na entimi maso ana.
Oh, so granted, yeah, and one granted, yeah, on bit my.
Oh, okay.
All right. I don't know if Ras, you can hear me. Okay, if Ras, I think Ras, I'll go offline. But let's quickly explain this particular video. No, concerning what the lawyer said. No, it's the information I gave before this whole video was played. Lawyer, no, actually, ma'am, who said the injunction, no, is still pending. Injunction, there, that means to say, court, everybody, bonting, you know, about be declared, say, Mami Akusia say, well, I need the legal right, we need the capacity, say or no, ebe you kunano. The injunction is still holds. Name no. Say a court teach me the babontin, eba be chima yehuni says, Mami Akusia say, well, I was the right to say, obey you kunane there, then the funeral no, ebe to me, akoso. And that is what a lawyer no, actually, actually, into the ordinance and the injunction on that members funeral no, is still pending. Till 28th of October, I court court ebe decree say Anne, you sat on the case and truly Mami Akusia say wa the legal right need to become the kunano. Still na the injunction no ehodi. Funeral no ida say beba so ana say ma so 28th October ene yebehwe the court ebeka.
All right. Bibi o hope you are the best so and say
Yeah, now the final one no one question and Krofo ebisa because it is very important. Which goes in this form, say, Eban saying, and a mammy Akusia say, over all these years, over 10 years, 15 years down the lane, waiting at Germany is when him say that Luban so any or Dobrunina at Tigana, when Timia Magana Mafishi Ukunida, once what now one of Musa, what Mamma Kashi, a then that Lumba Wuya, Wabe. Now, this is what a lawyer and a kind the reason why I'm here for all these years. Akusia say wa amagana da yanko video ne bra.
No, has to do with what you said after Moko court, you know.
I have the sister of Lumba here, and she represented Akusia Sewa in court today, and this demonstrates the kind of love the family has for Akusia Sewa. You get the point. So those out there who are making noise and making statements, they need to understand how all these things played out. And they should know that Akusia Sewa is the victim, not Odobroni. This is what we want to impress upon the country. It's Akusia Sewa who is the victim, having suffered desertion for 15 years, with 3 kids, managing them in an icy land. You think that is easy? So people should appreciate her concerns.
You will dance. Akusia Sewa a victim because only couldn't two kwa bruchre. Omo bobra bruchre na be man send the chi and ya. Or they go to Germany and say, oh, my operation was on new abrofo doctors in new. Among African star, number 1 upon Yakun. And to a professor of Bagana,
I'm sure you played that part in that, right? Was this the right video? This is what you were going to react.
Yeah, the right video. Now the point now me dey by me argument was one of na. Yeah.
Akosia se wane ne bagana. Omo ye ntuye wi odini jani sister. Eno koye. Ena be ma no wi operation no. Mi wura bra osime ma. Mi wura bra so ochina. Mi wura bra. Oba German ba kwa no asan return. Na mra wo free German na akosia se wa ba last one no otuano fo ano.
Okay.
That's how young the child was. I know back Ghana.
Okay.
Everyone, sune. Mamma, and yan numba mana woman in bed beam. And Colano so, Mamma and Ashomo. Now, dear young man, Nama Mamma, that's what Germany, Brandy said. Was it Omquaji facility view of over 100,000 euros? Yeah. I lumba home branum ko jinsa absikano. And then on a year Jumatuaka and into Mima because of bar a kind of a bear.
Okay.
And if I say that she's a victim, if you hear the story, she is.
Okay.
Unlike Odobroni or no buy another Lumba, either the Lumba. That's the dance if he that's a story building, a TV station. I know all those things are in a bush of phone at a Google, no more managing. He has been a beneficiary to the.
Okay. I am sure sir, the lawyer and watching the and say yeah, the part I am very sensitive about what you I doing is the facility of Mukokoji over 100,000 euros. Thinking say Nikuna Bagan never shown who you are or Beba Bakamaya sound so Akun Eka. Nanikuna Mabim. Into the question is Nankonon Mekanikun who are Ghana ha na Nanka Kananaho. Nanka, how would this whole thing be to me? Ayenka Lumba, but that's why Lumba with the Sakano. It might even be sent to be declared what we say, or Mabokrono, because you cannot take a facility without paying for it or whatever the agreement is. Then you move to a different country without hearing from you. That would have been a serious thing on that number. But I could say, when he decided when he said, after all, he's my husband. I have case with him. And he said, well, call Ghana, not Ghana, and I mean, worry about that. Mentioning Hanamen Kokano. And none of the coca there, and this is a problem when you're idea bay. Into more Montia, the reason why Kosia Sewa had to stay back Germany over these years now, paying Wabano. This is the reason. And
interesting. You know what would be really interesting is to hear from the other lawyer as well. Our lawyer friend, Adamfo, you know, I admire him very much. I know he's on top of his game. And to be honest with you, I wasn't surprised at all to see that he was representing Akosia Sewa. He's quite, you know, but what I would love to hear is also the argument from the other side. Because so far, what we are hearing, you know, is an argument from this side, which I think is solid in all, you know, its presentation and everything. However, the law is the law.
Yes.
So we have to wait for the law to be the final say.
All right. And you know, in the explanation so the lawyer now or the lawyer for Mami Akosia say one known as no or no court to say yama being maybe money because Ebusiani any year. He said went to Odobroni side it's because of Odobroni no one logic complaint there. One on finance in the uncle baby and reaching on the side in the Yankee, you know. Until now, the issue is between Odobroni and the Ebusia penny of that number. The issue, you know, Odobroni, Akosia Sewa, rather, Akosia Sewa, and the Ebusia penny of that number. Nemo Odobroni, the honor there. Nehunia said, Monko court on fast in the court. That is the reason why. And
now,
on
what's
28
family's attitude towards Odobroni?
Now the Odobroni the family now before Bishop Penny Beka say we need Odobroni. It was a penny nine Beka say no we need Odobroni.
Seriously.
Celebrity Bishop Penny. Say what say and wa kuhishim. Who say Odobroni no so that lumba ware ne ka ho. Interfere wa bejina tu. Look at this.
Another Dilumba warrior na unim ho hwe until say okwohwehwe mu.
Yes. And no ma ensasem na wo kan say so de nsa kofie no. Now the lawyer no for Akosua say wa kire say any fact bia enye no kore. Akosua say wa mfa nsa bia nkoma wo bia. Nti say true say Akosua say wa de nsa koye dia. The lawyer is asking for nipa kora nsa ni kosi ni so no because one yebusa pani. Na definitely me yes say busa pani nkwa betima tena se agensa. Yes say na other family members kan. Nti we need those that omoji sa nsa na kire say Akosua say wa kujaya aware no. That is what the lawyer is asking for.
Aware no any man na dey nsa koma oba ni nkofo. Okay, it's not just what this koma omo no. Sa nsa no na ya sending na dey omo chese oba ni. Okay.
Now you said one thing be very important. I also will be at here. The lawyer said, "Assemble a court, you can be charged for contempt." You even said something about it earlier on your submission. Say as it will be a cancelled with PBR. But one thing is, assemble a court, it's either you say it from the point of a lawyer. Said this lawyer said, but not what the court said. Say the moment because the court say you can be called in court to say court can answer one can. And the court and can you can be charged for contempt. And already the lawyer now says some people have been charged for contempt for and some of my kind concerning this whole issue now. If you know say injunction say why the court about to meanwhile court crime so. With all this, so what kind of thing you can be charged for contempt. So people should be very careful of this issue. But if will be take you on. So we all should be careful about this whole thing. That is what I can say for now. So on 28th October, say we will also get back to the lawyer. Not the BCBR, sound so at the radio quartet here for right on Art and Culture anytime, any day on 28th.
Sterling work. Fantastic job. Thank you very much, Synergy. Now, same way there. Ebio Dadilumba, a legend in life and in death. Because Dadilumba's name is eventually going to go in the ordinance books. Dadilumba's name is going to go in the law books. Right? Every cited case way for the future. And whilst even away from the court, Bema Bianso, warrior. Now they too move for no matter also because I don't know say if Dadilumba intended for such controversy to follow his demise.
He said he doesn't want something like this to happen after the death in Nenyoma or kind of Makrakramo. That is when the other time when we were having the interview, we said Ochame Kwame even said that Lumba is a prophet. He knew that he would be when you were teaching or and that song was written in 1992. Makrakramo na ekoye ti say obewunti no stage na okoto Makrakramo obi anama humudiem. That song was written in 1992 and it is really manifesting this year 2025 as if say a present issue no nim say this year and am panso esi na last quick one me first information from to your concerning this court issue of which I know the nyanso mu ba yesomu a the news information ebeba as it stands now on 15th October 2025. Mami Akosua Sewa and the elder sister for that Lumba Ernestina Fosu. And so the another court case as also at the abattoir with a press release stating they are calling for Ghana police and the German embassy in Accra and the investigative authorities in Germany say they want to investigate the death of that Lumba because certain things about the death look suspicious. So they are charging Priscilla Owusu or Priscilla O as the letter says. Our no and Philip Kwabena, aka Roman father. And that case in there at the hall we are working on the injunction. As we say, you be taking it on there. You young call home, but you call one. Say German embassy, any the German authorities, any Ghana police, every investigative to that Lumba Ewu. It is yet to be disclosed for all. We say really, we say was and now said something contributed to the death. That is what I can say for now about that.
Very, 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 even more controversy. And now, what makes it Ajagraja to mention, say, it was wrongful death. Now, Obi Emman Panye, the wrong injection or something to that effect. It's a suddenly the challenge and then it's real. But
if time of permit us, in Kamea call and Yaman or more reading almost suspicious. No? If time will permit us and Quebec, because I name me and son of my reading.
Because I'm waiting after you within by 3 minutes. Because Mr. One other person may be so and suddenly wrap up. Another 2 now, so near the wrap up.
All right, no problem. Now, and near my 3 almost 80 years, I am suspicious in the death of that Lumba. Mamia Kusia Sewa and the other sister for that Lumba or Nuli Jino Busiano. That is the brothers and sisters of that Lumba. A qualifier one is eyewitness account on the death of that Lumba. That eyewitness account in nature said before the death of that Lumba called a friend. So we with you. But when the friend go to the apartment of that Lumba or the residence of that Lumba, no, that friend wasn't allowed to see that Lumba. You're blocking him from not seeing that Lumba. For 2 solid hours, the man stayed behind doors waiting to be with that Lumba. We are my young one. Osi Kwanse say all after 2 hours, he had a phone call saying that Lumba. That is the first thing. And then a raised suspicion say, "Eba ni say that Lumba na nkasa de ne phone afro bi say brefi mi hian." Wo ba ya ma na kwan ma na hu that Lumba. Owu ye dia ma frɛ no. Say ni pa kora ne mra. That is one case. Now the next one, explanation Odobroni gave to the family after the death of that Lumba, and the explanation of the man police after the death of that Lumba. Nina contradicting. Now the one that the Odobroni gave the Busiano and he said that Lumba died Ewufi after Omudine call hospital no. Omudine buy no mu say why you weak. Emuna no wuye. And I want as a caring wife, I was so paper no addressing a camera. And now on going to me for body no enko morgue you know or a friend. And my friend in the best way in the mom did that Lumba call morgue and son we inform the family no. Now the police statement in say about thing after the death of that Lumba actually said they first sent that Lumba to diagnostic center in Accra. A whole omedical command injection because that Lumba was diabetic. That Lumba was diabetic. Another one, that Lumba was diabetic. But when only diabetic now, no, always or suffer severe pain in the legs and in the back. In the pain in the back, they have to take him to the hospital or diagnostic center. On injection of the man, the pain becomes very severe. Into no transfer to another hospital in Accra. Na eho and almost a command another injection be to under intensive care. And after a series of an injection, the man they have to take him home. Then no and the man who are at the hospital. And with this is the police report stating said this is how that Lumba died through the sequence but with all this sequence, it has been taken out. But the explanation given to the Bushian and they said that Lumba died at home after say you didn't call hospital born injunction. I went to Nyan survival and the money edu. So this suspicion, and the family air calling and they stated categorically in the press release mentioning the name of Ghana Police Service and 2 German embassy in Accra and the investigative department in Germany said they should investigate the death of that Lumba. They want the transparency of it. To date, that is what. And they stated the names are investigating and the names are one Roman father, the running mate for Piadonko. The running mate
for
Piadonko.
His name didn't come in there. Was he with him? Was he?
Yes, because on that Lumba manager.
Okay.
On that Lumba manager, and so anytime, any day, he was very close to that Lumba.
No. Was he with him?
Yes.
Is the question. Otherwise, why would his name come in? So a manager, but was he there? So no one will be
and that is what he has to also explain to court or wherever they ever as the reason why he abandoned him. And and the Odobroni to the NSA. Odobroni to the NSA. Per the information we know, that Lumba had no house help. Into meaning if you want to know, it was her and the kids. And she said that Lumba who fear she also needs to come and explain to the court. A queen of us who and say twice you are free. But I'm twice based on what issues are raised here, contradictory in there. Then the court will hold you accountable to whatever works you are now working there. You know, that is what and also at the honor pending. After the injunction, we see the way forward to that as well.
I see. Okay, question I'm pressing me before we wrap up now. In all of this, who the Nipa Bakupa maintaining cra? And I say, am I behind the times? Is he still alive? Is he still there? Nana Champon.
Nana Champon there. As you all know, that Luma met him in Germany. In Bibia has been in Germany life on Kwan. But he was seen during the 1 week. But after this, you know, like I said, a controversy between Akushia Sewa and the Busia Penny, but not anybody.
Yeah, but even aside from the marriage issues now, right from when he passed, I've noticed because that Lumba became the Lumba on the vehicle of Lumba brothers.
Lumba brothers, yeah.
Right, which was him and Nana Champon. I would assume saying Kabibi says, the first person can bet in the tribute would have been Nana Champon.
Oh, he came. He came.
In Kakra around all of this. Has he said anything?
Right?
Has he?
Oh, he hasn't said anything yet because as a brother, if you love your brother that much, you hold the integrity and the peace or whatever be an enemy hold it to. And son of the
but not when you would at least pay tribute, right? You'd at least pay tribute.
Tribute has been paid, but not controversies now. A person of Abe can be, and not the one kind.
Of course not. Of course, I don't expect him to join the controversy. I'm just saying, maintaining Kakra. Somebody say, tribute we crap and now say anything at all. I maintain be Biakra.
We will try and do the other time, even before the death, even right before the 1 week, we had wanted to contact Nana Champon. We got in touch with the manager. We wanted to talk to the Nana Champon about the feeling how issue, the death of that Lumba breaking the heart. But we were told he said, our Germany, now I feel no Obeba Ghana because of 1 week, And he reported around Friday, which was quite late for us to talk to him. And with all these, we and we need to about Ghana and one prepare, you have to go back and we'll call back. But we are finding time you beat me on the right time because now we will add you to the controversies. So as respectful as he is, he wants to hold on to maybe and son or Bekasa Wakasa.
Perfect. Also, you'll be a Sebi yet it's in Wufi, not Dreamudo, or you'll be a Bibisa is all over the place, back, just like that. We're holding him here. And I wonder, say, oh, Yamin Pengu, Yamin Fasamba, but Wakabi Bina Mente, na. But the way I mentioned, I was worried. Say, hold on, there must be something that I'm missing, But I'm happy to say we're holding who is. But eventually, I hope say Obeba out, not be paid. Proper tribute because me say there, me take Lumba. We that the Lumba feel I mean, say on it that in the Champo, and I mean, say maybe they had some little controversy, but that was way back.
Oh, it has been cleared off.
This or more sort of more differences that are yo synergy. What would you mind? We also share same way with chairman. I saw your lawyer. And I
because I spoke to your lawyer.
And then your interview with lawyer Kusini then so no, I'm sure that all that played, all that added to your understanding of the issues. But that's the part. Let me show. Next week, God willing, you'll be seeing Shabium on arts and culture on the show.
Okay. All right.
Thank you very much. All right. That was Synergy. Bismarck Appear Synergy. We all know him on the show. On this platform, he does extraordinary work for us. Thank you so much. And this is where we draw the curtain down for today's show. Ebeda masipi, mo munya bre joining ye nyina. Mo munya bre joining ye no. Mo munya bre joining ye no. They will share it with you. And also, this show will be segmentized and reposted on different social media platforms. So if you are on any of these platforms, look for the the snippets. On TikTok, which is just a quick one. Next week, God willing, we might go live on TikTok simultaneously. I'm not sure. Yeah, we're still working on that. Currently, we are live on Facebook and YouTube. We're working on going live on TikTok as well. We're still working on that. We will let you know what comes out of that. In the meantime, I want to thank you very, very, very much for joining us today. Unfortunately, we will not be able to take too many of the comments, but let's just take just this one. Ike Wonder. Ike Wonder says, I'm wondering what he's into. Which of all the things that we have discussed on the live stream is attracting the Ike Wonder. And then Ike Wonder also says 2 fingers. So I'm sure he's talking about arts and culture. He's probably talking about arts and culture. Bishop. But anyhow, Ike, thank you very much. Please do join us again next week and share your comments. Don't be shy, crowd, to share your comments and your thoughts with us. And let me also say, if you want to share the comments now, the best way to do it is to go on our Facebook page. I see some people commenting on my page. That will not show up in the system. I'm only sharing the show. So whatever you're seeing on my page is only me sharing the show. The actual show is on GH News Now. So when you're on YouTube or you're on Facebook, search GH News Now. That's where the action is. That's where, if you make the comments, they will come on the show, like what we're seeing with Ike Wonder's comment. So thank you very much again for joining us. And we will see you, God willing, next week with another sterling show. Enjoy your weekend. Enjoy the rest of the day. And we will see you. Bye-bye.